That gives us 13. Good morning. A quorum being present, the Committee on Veterans Affairs will come to order. Without objection, the chair may declare a recess at any time. There are meetings this morning to consider. We're meeting this morning to consider 25 important bills and 2 lease resolutions pending before the committee. I'm going to keep my remarks short to leave plenty of time for discussion on each of these bills and amendments being offered. There are a number of bills on the agenda here today and that are productive of that are a product of bipartisan negotiations. And I'm pleased to see our staff working together in such a productive manner for our veterans and the American people. I think this committee functions best when we work together to serve our veterans and do not let partisanship bickering overtake the ideas. It is in that spirit the ranking member and I have come together on a package of bills to improve the process for veterans and survivors to appeal claims. I am hopeful that these bills will shorten wait times for veterans and speed up the decisions before the board. I'm also pleased to consider legislation to improve the process for veterans who seek to receive health care within the community. I now yield to the ranking member for his opening remarks.
Thank you, Mr. Chairman. I concur with your message of bipartisanship. Of course, we stand our ground where we must, and we stand our ground where we must, but we seek common ground where we can. I'm pleased to let you know that I plan to speak on individual bills, so I'm happy to proceed to the business of this markup, and I yield back.
Thank you, Ranking Member. I now call up H.R. 740, the Access Act of 2025. The clerk shall report the bill.
H.R. 740, to improve the provision of care.
The text was circulated in advance and pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment at any point. I now recognize myself for the purposes of offering amendment in the nature of a substitute. The clerk shall report the amendment in the nature of substitute.
Amendment in the nature
I
of
ask unanimous consent that any further reading of the amendment in the nature of substitute be dispensed with. I ask that it be considered the base text for the purpose of this markup, and without objection, so ordered. I now recognize myself for 5 minutes to speak in support of the amendment and the nature of a substitute. The Veterans Access Act strengthens and promotes the Veterans Community Care Program. It picks up where the Mission Act and Choice Act started. Many of us members remember the wait list scandal of 2014. It is clear now as then veterans deserve health care choice. Community care is VA care. This bill would not privatize VA. I'll say that again. This bill would not privatize VA. 14 veterans groups and the veterans they represent stand behind this bill. Time and time again, veterans tell us about the roadblocks to their legal right to community care. Their stories demand action. The Access Act delivers. This bill, for example, would prevent bureaucracy from fudging wait times. A lawsuit revealing that employees who scheduled appointments at VA misrepresented dates of patients' request. That sleight of hand made wait times look shorter on paper, but it was a cook-the-books operation that harmed veterans, and our bill would do even more to empower veterans' choice. Let me make one thing clear. Veterans don't need their hands held. It's their health care. Our bill would make sure that the eligible veterans know their telehealth options. Telehealth is a lifeline that saves precious time driving, especially for rural veterans. For visits safe to be done online. Constituents in rural districts, like mine, and in other districts for many members on this committee, benefit from more telehealth operations. This bill would also create an online self-service healthcare dashboard. Why shouldn't veterans have this common sense tool at VA? Unfortunately, veterans tell us VA treats their care like a favor, not care they have earned. These changes would promote a culture at VA to treat veterans with the dignity they deserve. Our bill would also hold the Center for Innovation for Care and Payment accountable. I cannot tell you how many times members of this committee have asked, why does this center, what does this center do? The answer, crickets. This center has not innovated care. It has not innovated payment. It is time that changes. And our bill would make sure veterans know about community care fast. Veterans repeatedly tell us, I heard about community care months after trying to get an appointment, or worse, I never knew. The stories go on. Veterans are either delayed care or left without care. And it is a failure and a stain on the Biden administration for discouraging community care. The Biden administration conduct was not a one-off omission. It was a system-wide failure. With my ANS, this bill would take key steps toward better care for veterans. But this is not the end of the road. We want to require VA's referral standards prioritizing veterans' preference for care. Too many veterans have been denied their choice of provider in community care. We also wanted to increase access to residential rehabilitation treatment programs. These treatment facilities are available in the community and able to serve veterans usually within 48 hours of referral. Unfortunately, the referrals process is often delayed. Before we can act on these policies, we must ensure they are fully paid for. But rest assured, I am committed to work with VA and our colleagues to restore these provisions. I urge my colleagues to support this bill and continue with this committee's work on behalf of the veterans we serve. Do any other members wish to comment on the amendment in the nature of a substitute to H.R. 740?
Mr. Chairman.
Ranking member.
Mr. Chairman, I have an amendment to the, on my comments, I'm sorry. Yeah, Mr. Chairman, I strongly oppose the ANS to the so-called Veterans Access Act, which directly threatens the future viability of the VA healthcare system as we know it. It risks reducing veterans' choice and access to VA care. It risks reducing veterans' choice and access to VA care, despite what its proponents may claim. While I do appreciate that the majority has removed several harmful sections of this bill they originally introduced, which I think reveals a privatization motivation, and while I do appreciate the majority has removed those harmful sections of the bill, they did so because they have changed, not because they've changed their minds on the policy, not because they've changed their minds on privatization, but because the committee lacks sufficient offsets to pay for them. And that reveals another point, that privatization, lopsided privatization, because this side is we're not opposed to care in the community. There's a proper role for care in the community, but in the proper proportion. Privatization also is costly, and it is expensive, more expensive than direct care when it's not in that proper proportion. Nevertheless, as will be made clear through the amendments to the ANS that my colleagues and I will offer today, this legislation remains riddled with provisions that will do little more than hasten the outsourcing of veterans' health care, divert resources away from VA's direct care system, and dismantle VA's model of integrated, coordinated health care. Of greatest concern is the pilot program that would be established under Section 202, subsection C. It would create a 3-year pilot program in a minimum of 5 VISNs, whereby veterans would be able to seek outpatient mental health care and residential substance use disorder treatment from community providers without any authorization or referral and without any limit on the number of appointments or admissions. This is deeply troubling to me, as it should be to everyone who is invested in decreasing death by suicide among veterans. The majority of veteran suicide deaths occur among the veteran population that is not connected to VA. It would follow that connection to VA is a key aspect of prevention. Leaving veterans untethered in the community with no way for VA providers to know how a veteran is doing and whether they are continuing care and treatment is harmful. It's harmful to the veteran. Requiring referrals keeps that connection, that relationship in place, and it can be life-saving. This provision will also lead to a dramatic increase in spending on private sector care, diminishing the availability of resources for investments in VA's direct care system. And I have little doubt this will end with a I have little doubt that this will end with a 3-year pilot. Our Republican colleagues will do everything they can to make sure that this program becomes permanent. I am also concerned about a provision that was not in the underlying bill but slipped into the ANS. The chairman has added within paragraph 2 subsection A language that would enable veterans to no-show or skip their scheduled VA appointments in order to become eligible for community care appointments. Now, what this will do will deprive veterans of accessing those VA appointments, waste resources within VA's direct care system, and lead to even more spending on community care. For these and other reasons that will become clear as we discuss our amendments, my colleagues and I cannot support the chairman's ANS. So thank you, and I yield back.
I find it funny that now that the Republicans are in control, some of our colleagues are suddenly wringing their hands over so-called threats to VA. Let me be clear. The Veterans Access Act is about one thing: putting veterans first. It's about giving them real choice, real access, and real accountability when it comes to their health care. And it's not just Republicans saying that. This bill is supported by a broad coalition of veterans, service organizations, groups like the American Legion, the VFW, AMVETS, Concerned Veterans for Americans, and many others. These organizations represent millions of veterans who have made it clear community care is not a threat to the VA. It is not privatization. It is a necessary add to what we provide at the VA. And I'm tired of hearing the argument that opposing this bill somehow protects veterans. It doesn't. It protects bureaucracy. It protects the status quo. What it does do is protect the veteran waiting months for life-saving appointments or driving hours for basic health care. For my position as chairman, we're fighting for those veterans who kept their promise to this country and deserve a system that keeps its promise to them. I welcome my colleagues on the other side of the aisle to join us in this bill. Is there any other one seeking a comment on this legislation? Ms. Brownlee.
Yes, excuse me, Mr. Chairman, I have an amendment at the desk.
We're going to start amendments here shortly.
Oh, sorry.
Are there any amendments to the amendment in the nature of a substitute on H.R. 740?
Sorry.
I have an amendment at the desk. I have an amendment to the amendment in nature of substitute to H.R. 740 at the desk.
I now recognize, amendment to the amendment in the nature of substitute of H.R. 740. I now recognize ranking member to offer an amendment to the amendment in the nature of substitute. The clerk will report the amendment.
It's Condo Amendment 3.
I ask unanimous consent that further reading of the amendment is dispensed with, and without objection, so ordered. The gentleman is recognized for 5 minutes to explain his amendment.
Well, thank you, Mr. Chairman. My amendment strikes language in Section 101 of the ANS that bars VA from taking into account the availability of VA telehealth appointments when determining veterans' eligibility to receive community care. Now, this short-sighted provision will result in more veterans receiving more expensive care in the community, all the while taking away the ability for veterans to make a truly informed choice of where and how to receive their care. If this is about choice, veterans need a true choice, and this short-sighted provision will result in more veterans receiving more expensive care in the community, all the while taking away the ability for veterans to make a real choice. In fact, surveys of veterans have found that 80% of veterans find VHA telehealth care to be as helpful or even more helpful than in-person appointments when receiving mental health care. The reasons for this are obvious and applicable in many Americans' lives, not just veterans. Sometimes the hassle of receiving in-person care simply doesn't make sense when you can receive care from the comfort of your own home or office. And yet, when VA is determining whether veterans are eligible for community care referrals, it only takes into account the wait time for in-person appointments, even if the veteran would prefer to receive care via telehealth. As a result, veterans end up bypassing available VA telehealth appointments and end up receiving services from community care providers via telehealth. This is inefficient, and it's a wasteful use of VA's resources. I will acknowledge that VA's current technology does not allow the department to systematically take into account the availability of VA telehealth appointments when determining wait time eligibility for community care. However, VA has long been working to modernize its appointment scheduling technology in a way that would enable the department to factor in real-time nationwide availability of VA telehealth appointments in the future. This ANS would effectively prohibit VA from ever adjusting its eligibility determination process to reflect that. So my colleagues across the aisle like to talk about giving veterans the choice of how to receive their care. And yet, this ANS, as it's drafted, would give veterans less choice in opting for telehealth. At a time when more veterans than ever, when more Americans than ever, are receiving and prefer to receive telehealth when it makes sense and when clinically appropriate, this is an unacceptable double standard for veterans. That is why my amendment would strike this prohibition from the ANS and allow VA to take telehealth appointment availability into account when determining community care eligibility. I hope all my colleagues will join me in supporting this amendment, and I yield back.
The gentleman yields back. I recognize myself in opposition to the amendment. I oppose the amendment because it puts VA's convenience ahead of the veteran's needs. VA already has the authority to offer telehealth, and in many cases it can be beneficial. But it should always be the veteran's choice to decide if telehealth is right for them. To include telehealth in access and wait time calculations would pressure veterans into virtual visits they may not want, just to avoid eligibility for community care. For those who prefer or require in-person treatment, this would take that choice away and create confusion. This is not veterans-centered care, and I strongly oppose it. Does any other member wish to comment on the amendment? Seeing none. The question now occurs on agreeing to the Tucano number 3 amendment to the amendment in the nature of a substitute. All those in favor say aye. Aye. All opposed, no. No. In the opinion of the chair, the noes have it. Without objection, the motion reconsidered laid on the table. I now recognize Representative Brownlee to offer an amendment on number 4 to her amendment in the nature of a substitute.
Thank you, Mr. Chairman. As you know, I've always made it clear that there must be a balance between direct care and community care for our veterans.
The clerk, oh, you have an amendment at the desk.
I have an amendment, Mr. Chairman. I have an amendment at the desk. A little rusty this morning.
You're new.
Brownlee Amendment Number 4, amendment to the amendment in the nature of a substitute to H.R. 740, offered by Ms. Brownlee.
I'm asking that, and we don't have to do it because he already read it. So, without objection, ordered. The gentle lady is recognized. There we go. Now I'm caught up.
All right.
Confused
Here I
us
go.
both.
Okay. Third time's a charm. Thank you, Chairman Bost. As you now know, I've always made it clear that there must be a balance between direct care and community care for our veterans. However, the ANS to the Veterans Access Act of 2025 does not contribute to a sustainable balance between community care and direct care. Instead, its implementation would lead to a drastic expansion in community care to the degree that community care would supplant rather than supplement direct VA care. One example of this is how the amendment in the nature of the substitute adds a provision that would enable veterans to no-show for VA appointments and still have their community care eligibility determined based on the date they originally requested an appointment, essentially making them automatically eligible for community care. This policy would deny other veterans access to VA appointments and waste valuable time and resources of our VA providers who are already dealing with staff shortages and long wait times across the country. It also has the potential to significantly increase the number of veterans using community care, which in turn would increase overall costs of community care, slowly eating away at VA's ability to provide direct care for our veterans. My amendment would strike this provision that allows veterans to no-show for VA appointments as a means of being offered community care referrals. I urge my colleagues to support this amendment and ensure that VA is able to utilize its direct care appointments to provide quality care for our veterans. And with that, Mr. Chairman, I yield back.
Gentlelady yields back. I recognize myself in opposition to the amendment. The amendment would remove no-shows from the definition of canceled appointments. I, along with many of my veteran colleagues, have personally experienced VA canceling appointments on our behalf, and we never even knew we were scheduled. And as we have heard from multiple witnesses' testimonies at this Congress, this problem is not an isolated one. Veterans throughout the country deserve a VA that provides excellent customer service. This amendment would undermine that effort. I oppose the amendment, and I urge all of my colleagues to do the same. Does any other member wish to comment on the amendment?
Yes, Mr. Chairman.
Ranking member.
So if this issue of canceled appointments without the veterans knowing about it is an issue, and it's been documented, the target should be that VA process. We should be overseeing VA and insisting that they discontinue this practice. But to throw out completely a tool to say that we incentivize veterans to not show up for their appointments so they can qualify for community care, you know, we could, I mean, it's common sense. We're going to see that. That's
not what the amendment.
That's a wrong-headed policy. Your president ANS allows for that to happen, and that's what we're trying to fix here. I completely oppose, and I would say all members here would oppose allowing VA to cancel appointments, what you just said, without the veteran's knowledge. That is a waste of resources. But it's likewise a waste of resources for a veteran to not show up for their appointment, deny other veterans that could have used that appointment, and then go into the community for care that is probably going to be more costly to the taxpayer. We're just trying to enable. It's our job to oversee VA and to make sure they're operating as a system efficiently and properly, not to set up. It's not in our interest or the taxpayers or the veterans' interest to set up a system whereby we encourage waste. This is an encouragement of waste, and that's exactly what I thought this administration was opposed to.
And I simply disagree with you that it's a waste. The problem is that we're hearing about it being used as a tool against the veterans in a way that should not be done. And many of us as veterans have had this problem occur. So it would have been great had they done it on their own, but that's why we're carrying a law to make it force them. And we do that all the time here. That's what we do. When we see problems in the VA, we create a law to try to correct a problem. This corrects a problem where we have VA employees using this particular measure as a tool to deny our veterans certain services.
Mr. Chairman, might I yield some time for Ms. Brownlee to respond?
may.
Thank you.
Thank you, Ranking Member. And Mr. Chairman, I think you're referencing a different provision in the bill, one that deals with VA canceling the vet's appointments. Your amendment strikes the language right below that to enable the vet to no-show. And it is, I'm sorry, where is it? Right, exactly. So I'm talking about the language that says includes a scheduled appointment for which the veteran fails to appear. You're talking about the means a scheduled appointment with a healthcare provider of the department that is canceled by the department for a reason other than requested by the veteran.
Right. All that does is provide them their choice. So it doesn't allow them to be punished for a misscheduled appointment. And
I know, but the language is really referring to what my amendment is about the part of the bill that talks about no-shows, that if a veteran doesn't show up for an appointment, a scheduled appointment, then he or she then has complete access at that point to go directly to the community care.
I feel our language is correct. Okay.
I don't.
I got it. I got it.
And I hope my side will vote in favor of my amendment.
You're recognized.
Okay, thank you, Mr. Chair. I just want to acknowledge, as a physician who has a hard time getting my patients in prior to this, especially at the VA, where it takes time for people to get an appointment, if we do not use those appointments wisely, it cascades to less accessibility for all veterans. So if someone knowingly uses an appointment that is scheduled, not intending to come in as a means to get a community care referral, that is a failure of our system. Community care referrals should be easy to come by, and I certainly don't want to get in the way of that, but using appointments to be able to access that is a waste in the system and will delay care for all veterans. It absolutely should not be used as a means to being offered community care. I agree with the sentiment that veterans should have the ability to miss appointments, but if it is for the mechanism of getting a community care referral, that should not be in this bill. And I strongly support this amendment.
Yield back. Any other? Seeing none, the question now occurs on agreeing to the Brownlee amendment, in the nature of a substitute. All those in favor say aye.
Aye.
Opposed, no. No. The appearance of the chair, the noes have it. The agreement is not agreed to. Without objection, the motion to reconsider.
Mr. Chairman, I request a recorded vote.
A recorded vote has been requested pursuant to committee rules. This vote will be postponed. I now recognize Representative Conaway to offer Conaway Amendment number 5 to this amendment in the nature of a substitute.
I thank you, Mr. Chairman.
Clerk will, you have an amendment at the desk? The clerk will report the amendment.
Conaway Amendment number 5.
I ask unanimous consent for further reading of the amendment to be dispensed with, and without objection, so ordered, the gentleman is now recognized for 5 minutes to explain his amendment.
I thank you, Chairman Boss. My amendment revises a provision of Section 104 of the ANS pertaining to the discussion of telehealth appointments as an option for care. I appreciate that the Chairman's ANS will require the VA to discuss telehealth as an option for care. He has stressed that veterans should have an option in how they receive their care, both within the VA healthcare system and in the community, when telehealth is available and appropriate and acceptable, and this is the key phrase there, acceptable to the veteran. While there aren't many bright spots in the COVID-19 pandemic, one positive outcome is that it accelerated the delivery of care via telehealth. Seemingly overnight healthcare providers nationwide, including the VA, figured out how to efficiently deliver a wide variety of services via telehealth. And many patients, including veterans, found they liked it. It saved them from taking lots of time off work, finding someone to transport them to VA or other clinics, making long drives, circling the parking lot, finding a spot, et cetera. It was a great convenience. In New Jersey, where I passed telehealth legislation and the subsequent study found that it saved money. It offered a great deal of, it was widely received by the public and delivered care that was essentially the same as they might receive in an in-person setting. My amendment is simple. If a telehealth appointment is clinically appropriate and the veteran wants to have their appointment via telehealth, agrees to that a telehealth appointment and wants to be seen via telehealth, then their eligibility for community care referral should be determined on the basis of wait time for VA telehealth appointment. That is, determine what the wait time is within the VA for that veteran who desires to get their health care via telehealth and not via an in-person appointment at the VA as it is now. If the veteran has expressed interest in a telehealth appointment, they should not be bypassing available VA telehealth appointments only to eventually receive telehealth in the community. My amendment would ensure that existing VA resources are used efficiently and that the VA's clinical capacity is fully maximized. I urge my colleagues to join me in supporting this amendment, and I yield back.
Gentleman yields back, and I recognize myself in opposition to the amendment. As I stated earlier, VA already can offer telehealth appointments to the veteran, but it should always be veterans' choice to decide if that is right for them. I oppose the amendment, and I urge all of my colleagues to do the same. Does any other member wish to comment on the amendment? Seeing none? Well, no, okay. Seeing none. The question now occurs on agreeing to the Conaway Amendment, number 5, to the amendment in the nature of a substitute.
Mr. Chairman, if, I wish to be recognized,
Okay.
and I will yield to Mr. Conaway.
Okay, there we go.
Just briefly, the point of my amendment is to make sure the veteran can exercise the option to use telehealth if the veteran thinks that that is in his or her best interest. I yield back.
And as I said, they already have the option right now, but in no way should they be forced to take that option. It should be the veteran's choice. Yield it back.
I yield back, Mr. Chairman.
Okay. The question now occurs on agreeing to the Conaway Amendment number 5, the amendment in the nature of substitute. All those in favor say aye.
Aye.
All those opposed, no. No. Opinion chair, the noes have it. Yes, you sure can. A recorded vote has been requested pursuant to committee rules. This vote will be postponed. I now recognize Representative Dexter to offer an amendment in the nature of a substitute.
Mr. Chairman, I have an amendment to the amendment in nature of the substitute at the desk.
The clerk shall report.
Dexter Amendment number
I ask
6.
unanimous consent that further reading of the amendment be dispensed with, and without objection so ordered, the gentlelady is recognized for 5 minutes for her amendment.
Thank you, Mr. Chair, and thank you to my colleagues for your attention to this important amendment. This amendment represents a necessary step toward greater accountability, transparency, and patient empowerment at the VA Community Care Program. At its core, it's about putting veterans first. It's about ensuring that those who have worn the uniform, who have sacrificed for this country, are given the information they need to make informed, patient-centered decisions about when and where to receive care. Under current law, veterans are eligible for referrals to community care if the VA cannot provide an appointment within 20 or 28 days, depending on the type of care. These standards were put in place under the Mission Act with the intention of expanding timely access. But there's a major flaw. Veterans are being asked to choose between staying within the VA system or seeking care in the community without knowing whether that outside provider can actually see them any sooner than the VA. We are telling them that they have a choice, but it's a choice made in the dark. No comparative data on wait times, no visibility on drive times. This is not patient-centered care, and that is not transparency. So, my amendment directly addresses this issue. It would require the VA to provide veterans with data comparing wait times and drive times between VA facilities and community providers so that veterans can make meaningful decisions about where to get their care. If we're serious about access, if we're serious about quality, then we must be serious about giving patients real information. Community care is meant to be an extension of the VA, not a substitute for it. But when veterans are directed to the private sector without full information or meaningful coordination, the system breaks down. It creates confusion, disrupts continuity of care, and too often leaves patients navigating a fragmented system. Too often, veterans are left trying to stitch together the system on their own. They don't know who's responsible for what. They don't know when or if they'll be seen. They don't know if their treatment will be coordinated across the systems. This results in delay, confusion, and far worse, preventable breakdowns in care. This is not just frustrating, it's dangerous. For the sake of our veterans, we must build a system that functions, not just on paper, but in practice. That means ensuring every VA patient receives timely, high-quality, and coordinated care, whether that care is delivered inside the VA or by a community provider. And the only way we can do that is by arming veterans with the information they need. My amendment gives them the tools to make those comparisons on wait times, on travel times, on outcomes, because true choice requires good data. So let me close with this. This should not and must not be framed as a fight between VA and community care. That's a false choice. That's the wrong debate. The right question is, what does the veteran need, and how do we deliver that care responsibly, quickly, and with the highest possible quality? This amendment empowers veterans with the data they need to make informed choices. It promotes transparency and accountability and takes a meaningful step toward building a system that delivers on our promises. Because here's what really comes down to. When we send men and women to fight for this country, we make a commitment to stand by them when they come home. This promise doesn't end when the uniform comes off. It doesn't end when the war is over. And it's a lifelong commitment. So if we truly believe that, if we truly want to honor that, then we have to give this right to them. This amendment is one small but powerful way to do it. I urge my colleagues on both sides to support it. Thank you, Mr. Chair. I yield back.
Lady yields back. I recognize myself in opposition to the amendment. I oppose this amendment because it gives scheduling control back to the VA bureaucracy that has repeatedly failed. During the last administration, VA was found to have manipulated wait time data and appointment availability. The Veterans Access fixes that and would create a useful tool to allow veterans to make informed decisions and schedule their care without relying on VA administrators who may or may not be providing accurate information. The amendment would undercut those efforts, and that's why I oppose it. Does any other member wish to comment? Ranking member.
Mr. Chairman, this does not give power to the bureaucracy. It gives power, Dr. Dexter's amendment gives power to the veteran by giving the veteran more information. Dr. Dexter, would you like to respond?
Yeah,
I yield to you.
Thank you so much, Ranking Member Takano, for that. That is precisely it. It doesn't do anything to the VA. What it requires is that the data from community care is available so that data can be compared. Not manipulated, not weaponized, but so that the community care providers have to provide the same data that the VA must provide so that they can make an informed decision about where to get care. If they want community care, and they're willing to wait longer, that is a decision the veteran should have. But if they want care sooner than later, and the VA can provide that sooner than community, they should be able to have that information. That's simply not available right now.
And common sense would say that that VA already had that right and they blew it. During the last administration, there's a real problem here with the VA and their concern over not using community care. And they've given false information to our veterans and not giving them the full information as what's available to them. That is why we're putting this in, and that's why we're having, this is the problem. When you have a bureaucrat that wants to stand in the way of what we pass in law, and just so you know, we've got emails from the upper, that was sent out to our VISNs saying to make sure community care is not an easy button. That is the problem. We have that information, and that's what we're dealing with here. So we're saying to go ahead and turn it back over to them, thinking that they will give that information correctly. They could have given that information correctly before, but they chose not to.
Mr. Chairman.
Yep.
Reclaiming my time. Dr. Dexter?
No, thank you so much. So just to be clear, I just want the community to have to provide that same information, and that has not been required. So it is simply asking for that, and I am not saying anything about what the VA is suggesting or doing with their data. We should require good quality, reliable data from the VA as much as we do from the community. There is no question here in my mind. What we need is to center the veteran and make sure that they have good quality data that is updated and appropriately reflects the actual wait time as well as drive time. I think we both want the same thing, and all this does is asks for the community to be accountable for supplying that data as well as the VA. Thank you.
Yeah, thank you for reclaiming my time. Mr. Chairman, I think this committee should hold more hearings into community care coordination. We should have more. I want to know about instances that you are saying happened under the previous administration. I was here during the wait time scandal during Phoenix, and that was a terrible thing. It is this committee's job to hold the bureaucrats responsible if they are bad actors and if they're not treating the veterans right. But it is not in the veterans' interest or in the American taxpayers' interest to create an imbalance between the direct care system and the community care system, dismantle and disable the coordinated nature of it. That doesn't help the veteran if we can't get the records back and coordinate the care with community care providers. I think a veteran should be able, if they're eligible, that 30-day mark happens and that drive time, that if they're given the option of community care providers, they should know how long it's going to take to drive to that community care provider in the community versus go to the VA even after they're eligible and say, yeah, even though I'm going to wait a little longer, I'm going to stick with the VA because it's going to take me longer to get there. They should have that information. That's all Dr. Dexter is saying. I would go further. I think every American, when they enroll in a health care plan and they're choosing between 10 health care plans, they should know which health care plan has wait times that are this long for oncology versus this health care plan. That information is not available. We've only seen this insistence that VA be accountable for wait times, but no one else in the community. And so it's not a real choice for a veteran to say, to be moved into the community. That's more choice. The real choice is, hey, I may have to wait a little longer for the VA appointment because I have to drive longer to get over here. It's more inconvenient. So that's real veteran choice. And all Dr. Dexter is saying is, let's make that information also required of the community care system. They should know how long it's going to take to get there, how long it's going to take to get that appointment, and have them weigh what's available in the VA. And we are getting the technology available to make that happen. And I yield. I'll yield back.
Okay, I'm still going to oppose it at this time, but I will, as we move forward, because this bill needs to move forward, and we will look to see, because I believe our language allows that choice for the veteran and tries to stop the problems that were occurring. I will look at it a lot closer, but we're going to move forward with this, and I'm still going to oppose the amendment.
And what about hearings into the community care coordination?
We can see while we're doing that later on, but right now with this markup, and we'll look into that. Take it under advisement. Anyone else?
Mr. Chairman, I think our language is very clear to implement such other matters as determined appropriate by the Secretary in consultation with third-party administrators. That's the language that is good enough here. If I could just suggest to my colleague, perhaps just a letter from the Secretary expressing an interest in exact implementation of that paragraph, rather than us trying to put something into law that the Secretary can do today. All we need to do is indicate an interest. Mr. Chairman, I'll oppose this, but I think there is a way forward for my colleague. Thank you.
Thank you. Anyone else? Seeing none, the question occurs on their agreeing to the Dexter amendment, to the amendment in the nature of a substitute. All those in favor say aye.
Aye.
Opposed, no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to.
Mr. Chair, may I request a roll call vote? Thank you.
A recorded vote has been requested pursuant to the rules. This vote will be postponed. I now recognize Representative Brownlee for amendment number 7 to an amendment of the nature of substitute.
Chairman, I have an amendment at the desk.
The clerk will report.
Brownlee Amendment
I
number
ask
7.
unanimous consent that further reading of the amendment is dispensed with, and without objection so ordered. The gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. In this Congress, between the Health Subcommittee and Full Committee, we've already had 4 hearings conducting oversight of community care at VA. During these hearings, my colleagues and I have advocated for many ways to improve the community care program, including policies to require more transparency from community providers and expand VA's ability to oversee providers to ensure they have the same quality of care that we expect from our VA providers. On this issue, Mr. Chairman, I'm happy to work with you to improve upon the process. in terms of obtaining outpatient mental health care. But this provision within the VA's Access Act creates a 3-year pilot program to allow veterans in at least 5 VISNs to obtain outpatient mental health and residential substance use disorder treatment from community providers without VA referral or authorization does what I believe is not good ultimately for the veteran. It poses an irreversible threat to VHA's survival as an integrated healthcare system by shifting VA's primary role from being a coordinator of care to merely paying invoices for veterans being treated at outpatient and residential facilities. Eliminating VHA as the authorizer of care means that over time, there will be fewer, not more, options for veterans, since more funding and resources will have to go to the community as this pilot will provide completely unfettered access to community providers. I'm especially concerned about what this will mean for residential rehab. There is a serious lack of oversight over community providers of residential substance use disorder treatment facilities. We are already seeing providers targeting veterans for admission to their facilities because of their potential to profit from VA's lack of a fee schedule. I understand the desire to ensure veterans have access to mental health care. That's something we all want, but there is no guarantee that veterans receiving care in the community will get better, more timely access to care, and we don't know if they do because VA doesn't track that. When veterans do access care at residential treatment facilities in the community, we have no way of knowing the level of treatment or support they're getting. We don't know if veterans are receiving care from providers who understand what it means to be a veteran and can establish a rapport with their patients. We don't know if they are being referred back to VA care in a timely manner, as VA is in the best position to coordinate their overall care beyond treatment for their substance use disorder, which is often just one aspect of their overall healthcare needs. This pilot program is clearly a giveaway to private sector entities that have a vested financial interest in treating veterans, a population that they admit in their own hearing witness statements that they have not been able to access because so many already receive care at the VA. This is why my amendment to strike this provision from the amendment in the nature of the substitute is needed. I'm offering this amendment because I have real concerns and they are worth discussing today, Mr. Chairman. And as I said earlier, I'm happy to work with you in any way to streamline this process, but we should not lose coordination and oversight of the veteran and the VA's patients. And we certainly must have a pricing schedule for what that all is. But I know, Mr. Chairman, you disagree with that, so at this time I will respectfully withdraw my amendment, and with that I will yield.
The lady withdraws her amendment. I
Hope
now,
that you'll work with me.
I will. Okay. I now recognize Representative Sheffield McCormick to offer the amendment in the nature of a substitute.
Thank you, Mr. Chairman. My amendment to
You
HR.
have a member at the you have an
Oh, I have an
amendment.
amendment at desk.
The clerk will report the amendment.
Sheriff McCormick, Amendment Number 10.
I ask unanimous consent that further reading of the amendment be dispensed with. Without objection, so ordered. The gentlelady is recognized for 5 minutes for her to explain her amendment.
Thank you, Mr. Chairman. My amendment to HR 740 institutes common sense community providing training requirements to ensure veterans are receiving the highest quality and culturally competent mental health and substance use disorder care they deserve. To become a mental health provider at the VA, individuals are mandated to undergo extensive training related to military culture, traumatic brain injury, PTSD, and opioid safety. These stringent requirements exist to address the unique healthcare needs to our veterans that are not typically found in the civilian population that necessitate specialized treatment Whether a veteran receives care directly from the VA or from the community, the standards for mental health providers should not differ. Unfortunately, Section 202 of the Access Act, as currently written, creates a pilot that allows unfettered veteran access to outpatient mental health and substance use disorder services with virtually no safeguards and no guardrails on competency or qualifications of community providers treating veterans through this program. Under this bill, mental health providers, regardless of their background and familiarity with the military culture and conditions that disproportionately affect veterans, would be able to participate in this program. The pilot fails to ensure that community providers treating veterans have on issues like PTSD, traumatic brain injury, military sexual trauma, which they have little or no experience treating. My amendment resolves this by mandating that non-departmental providers complete training through the VHA Train platform within 180 days of enactment of H.R. 740. Community mental health care providers would be required to complete the very same training that is required for VA mental health providers. If a provider fails to meet this initial deadline, my amendment will authorize the VA Secretary to issue formal warnings and grant an additional 60 days for the provider to comply. If the provider were again to fail to complete the requisite training, the VA Secretary would place the provider on a temporary 90-day suspension. The provider would still be able to participate in the pilot program after 90 days of assuming they completed the mandated training. Only after failing the third time will the provider be removed from the pilot program. This amendment is common sense, protects the health and well-being of our veterans, and protects taxpayers. I urge our colleagues to vote yes to this amendment. I believe this amendment would also strengthen our ability to serve our veterans with the best competency. Thank you. I yield back.
The gentlelady yields back, and I recognize myself in opposition to the amendment. The amendment is yet another requirement for community providers to take VA training. This training is already available to providers. The amendment would create more red tape and not let doctors be doctors. It does no good for veterans to have more ways to lose access to VA care. That's what the amendment does. I oppose it. Does any other member wish to comment on the amendment and the amendment?
Yes, Mr. Chairman. Mr. Chairman, the third-party administrators and the networks they've set up should be subject to at least some requirement that they meet VA's standards. It has been to my great distress that there's been an unwillingness to make that the community care networks do not provide this training. I want to yield to Representative Shirley McCormick to respond.
Mr. Chairman, my amendment does not restrict doctors, but it actually empowers doctors by giving them adequate training so they can understand what they're recognizing. It actually strengthens and supports them in training our military personnel. What we're doing is turning a blind eye and allowing doctors who don't know what's coming at them or what to look for not to make themselves aware. A suggestion would only be a suggestion. A requirement would standardize what we're seeing in the VA and in the community, which is necessary. The VA is never going to be able to move forward, especially with community care, if we don't have some form of standardization. So this would actually promote both interests as far as the doctors and the actual patients, and we have a responsibility to make sure we're empowering them. This in no circumstance is red tape. If so, then why would doctors actually be subjected to continuing education? So this is a standard process that we already see in the VA, and it should be required to help our veterans. They have unique needs, and they deserve unique treatment. For us to deny that is a failure on our part. We have to accept what we have here, and we have a unique class of people who deserve unique treatment.
Thank you. Reclaiming my time, I recall there was a moment when we had a serious opioid safety issue with VA providers prescribing opioids and veterans paying the price as a result of it. And there was an enormous effort to get training out to VA doctors on the guidelines of VA standards on how opioids would be prescribed and how they'd be monitored. That could not be required of our community care providers. Because why? The third-party agreements wouldn't allow for that. It's common sense that when VA was trying to respond to an opioid crisis within its own midst, that it responded internally with its direct care system. But it's crazy that you want to say that my Republican colleagues on the other side want to say that community care is VA care. But if the same standards don't apply to community care, if we don't upgrade the awareness of community care doctors about how and when opioids should be prescribed and how they should be monitored, that is not really VA care. That is something else. That is a lack of attentiveness to the very specific needs that veterans need because of who veterans are, whether it's post-traumatic stress disorder. Community care providers may not have the specific background or understanding about how to respond to that, or traumatic brain injury. VA doctors, because of the academic affiliations that VA has, this is part of the culture of medicine within the direct care system. And to say that we don't want to have third-party administrators and the networks they set up have their provider networks reflect this similar expertise, this to me does not make any sense, and it is not good for the veteran. And I yield back, Mr. Chairman.
Representative Dexter, you
Yes,
recognize.
thank you, Mr. Chairman, and I very much appreciate your point about letting doctors be doctors, and I normally do not support mandates, but in this case, this is not a mandate for all doctors, it's just a mandate for doctors who wish to treat veterans with these issues so that they can get those community care contracts, and that should be the expectation, that they have the same level of training and background to address these issues as VA physicians, so the information that they receive is not mandated unless they want to receive that reimbursement for taking care of the veteran, in which case the veteran should have the same access to the same quality of care that they would expect at the VA. So I strongly support this amendment for that reason.
Appreciate that. Anybody else? So the important thing to remember here is that each one of these community care providers actually have a contract with the VA. VA can require already certain things of those, but that's the flexibility that's left to the secretary. So with that, anyone else seek recognition? Seeing none, the question now occurs on agreeing to the Shifless-McCormick amendment to the amendment in the nature of a substitute. All those in favor say aye.
Aye.
All those opposed, no. No, independent chair, the noes have it. The amendment is not agreed to. And with objection, the motion to reconsider laid
I
on.
would like to request a recorded vote.
A recorded vote has been requested. Pursuant to committee rules, this vote will be postponed. I now recognize Representative Takano to offer an amendment number 8 to amendment to the nature of substitute.
Mr. Chairman, I have an amendment to the desk, to the ANS, to HR 740 at the desk.
The clerk shall report the amendment.
Takano Amendment
I
Number
ask
8.
unanimous consent that further reading of the amendment be dispensed with without objection. So ordered. The gentleman is now recognized for 5 minutes for his amendment.
Thank you, Mr. Chairman. My amendment requires that community providers offer substance use disorder treatment to veterans under the pilot program in Section 202 be accredited by both the Commission on Accreditation of Rehabilitation Facilities and the Joint Commission. In addition, it would bar these providers from directly marketing to veterans or using patient recruiters to enroll veterans in their services or programs. I agree with my colleagues across the aisle that all veterans who are ready to seek assistance with substance use disorders should be able to quickly and easily access high-quality treatment. However, the rehab industry is rife with bad actors, and VA must have guardrails in place to ensure the quality of the care veterans receive in the community. As the Health Subcommittee discussed at a hearing on this topic early this year, VA lacks oversight over the community care providers from which veterans receive substance use disorder treatment or many other kinds of community care. VA does not track whether veterans receiving care in the community are getting better care or more timely access to care than at VA. The level of treatment and support that veterans receive from these providers is also not tracked. If that weren't bad enough, drug and alcohol rehab facilities hold a track record of deceitful, harmful, and in some cases, deadly practices. For example, in August 2021, one such provider's lax safety standards allowed a patient to fall from a designated patient and smoking area on the roof of its facility, rendering the patient permanently paralyzed. My amendment would ensure that veterans only receive care from accredited, vetted providers that meet the quality of care standards. The accreditation process also ensures that there are mechanisms by which bad actors will face consequences for actions that harm their patients. Worse yet, VA does not have a fee schedule for residential rehabilitation treatment. This sets up a concerning incentive for bad actors to enter VA's network, effectively set their own rates to provide care to veterans and exorbitantly bill VA for reimbursement. This is unheard of in the private sector, that a provider could set their own rates and get them paid. This issue was further highlighted in December 2024 when VA's Office of Inspector General issued a fraud alert notifying veterans of reports of treatment centers targeting veterans through illegal and unethical advertising practices. These providers clearly have a vested financial interest in treating veterans. The pilot program in the chairman's ERNEST, which would allow veterans to access residential rehab without VA referral or authorization, would place veterans at even greater risk of being targeted by bad acting for-profit actors, for-profit motivated actors. My amendment's restrictions on advertising to and recruiting veterans would help keep veterans safe from such fraudulent practices. Part of keeping our promises to our veterans includes ensuring they can receive care quickly and easily. It also includes conducting vigilant oversight to ensure that the care they receive is safe and effective. To this end, my amendment would help VA filter out fraudulent and harmful treatment providers that take advantage of veterans in vulnerable positions and prioritize profits over quality care. With that, Mr. Chairman, I yield back.
The gentleman yields back, and I recognize myself in opposition. This amendment would add back in red tape we are trying to cut with this bill. The VA has guardrails in place with residential programs to ensure they are accredited. I'll say that again. They already do that to make sure they're accredited. Further, there are many direct market prohibitions in the VA contracts. These are matters the agency should handle through contract negotiation, not legislation. Does any other member wish to comment? Seeing none. The question occurs on agreeing to the Takano Amendment number 8 to the amendment in the nature of a substitute. All those in favor say aye.
Aye.
Opposed, no. No. In the opinion of the chair, the noes have it.
I request a recorded vote.
A recorded vote has been requested pursuant to committee rules. This vote will be postponed. I now recognize Representative Miller Meeks to offer her amendment to the amendment in the nature of a substitute.
I have an amendment at the desk.
The clerk shall report the amendment.
Miller Meeks amendment. Amendment to the
I
amendment.
ask unanimous consent that further reading of the amendment will be dispensed with and without objection so ordered. The gentlewoman is recognized for 5 minutes to explain her amendment.
Thank you, Mr. Chair. When veterans receive community care referrals, the referrals are only valid for a fixed period of time. That's because sometimes a referral is not just for one appointment, but for a health problem that may require multiple appointments. In addition, it could well be that the provider doesn't get the request for the appointment until after the appointment time has already started. The idea is that over the course of a few months, the veteran should have the opportunity to see a specialist as many times as it requires or is directed medically. As a physician, I know this problem firsthand as I was a community provider. However, due to provider shortages and bureaucratic delays, veterans may not get seen until halfway through the authorized time period or even longer. Many times the referral will expire in the middle of a treatment course, which requires the veteran to go through the process of getting a subsequent referral, which is more paperwork, more stress. Veterans don't like it, and nobody likes it. This amendment includes the text of my START Act, which would address this issue by ensuring that the validity of that referral begins only once a veteran has attended their initial appointment. This way, the veteran is able to benefit from the entire referral time period, rather than feel pressure to beat a bureaucratic clock. This amendment is an affirmation of putting the veteran first, and that the care should happen on the veteran's timeline, not on the VA's timeline. I urge my colleagues to support this common sense amendment. Thank you, Mr. Chair. I yield back my time.
The gentlelady yields back. I recognize myself in support of the amendment. My friend and colleague, Representative Miller-Meeks, Dr. Miller-Meeks, has discussed the current referral authorization process by the community care and is not centered on the veteran, but the VA bureaucracy process. This amendment would fix that process so that it is focused on the veteran's timeline, not on VA's. Simply speaking, the clock should only start ticking once the veteran gets care. This would not only make it easier for the veteran, but would also allow providers to focus on caring for veterans rather than chasing needless deadlines. This would be simple and efficient fix, and I urge my colleagues to support this amendment. Does any other member wish to speak on the amendment? Seeing none. The question now occurs on agreeing to Miller-Meeks' amendment in the nature of a substitute. All those in favor say aye. 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 All those opposed, no. Independent Chair, the ayes have it, and without objection, the motion to reconsider is laid on the table. I now recognize Representative Barrett to offer his amendment in the nature of a substitute.
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk shall report the amendment.
Barrett amendment. Amendment.
I
to
ask
the-
unanimous consent that further reading of the amendment be dispensed with, and without objection, so order the gentleman is recognized for 5 minutes to explain the amendment.
Thank you again, Mr. Chairman, and thank you to the committee for consideration of my amendment. The amendment in the nature of a substitute would add my bill, the Veterans Hearing Health Expansion Act, to Chairman Boss legislation, the Veterans Access Act, and I appreciate your willingness to take up this amendment for consideration today. This amendment is fairly simple, and it would just make it easier for veterans to access hearing aid services in their communities and make it an easier process for them to follow. Right now, VA community care programs will reimburse providers for health care at community care providers that will reimburse right now for audiologists and other specific hearing specialists, but it does not currently include, and it actually excludes, licensed hearing aid specialists. These professionals are able to adequately fit, adjust, and repair hearing aids, but they're not allowed to help our veterans in this process. This bill and this amendment now, adding this bill, will cover that gap in coverage that often forces veterans to travel long distances or wait extended periods of time to receive care only at a VA facility, even for far simpler procedures like getting a hearing aid refitted or maintained. My bill will fix this problem by allowing veterans to seek care from licensed hearing aid specialists in their local communities, ensuring faster and more convenient access for the services that they need. Veterans deserve timely, high-quality care no matter where they live. Expanding the VA's community care program to include hearing aid specialists when it already covers other audiology professions is a common sense way to achieve that goal. This bill is a simple fix that will make a big difference, especially for veterans in rural communities, not just in my district and in my state, but across America as well, by giving them more access to options and less red tape when it comes to maintaining their hearing health. I urge my colleagues to support my amendment, and Mr. Chairman, again, I appreciate your willingness to take it up today.
Gentleman yields back. I now recognize myself in support of the amendment. The amendment would recognize hearing aid specialists in the community care network. Take it from me, when you serve in the armed forces, you tend to come across a lot of loud noises and things. The hearing damage we get while serving worsens and never gets better. I think it's important to increase access for our veterans to hearing aids and those who specialize in them. I thank Representative Barrett for this amendment, and with my voice, I support this. That's why I voiced some of my support for it. Does any other member wish to comment? Mr. Chairman. Ranking member.
Mr. Chairman, thank you. I reluctantly, and I underscore reluctantly, must oppose this amendment, and I encourage my colleagues to do the same. I would have liked to have been able to work with Mr. Barrett to improve this amendment before it was offered, but unfortunately, we were not aware it would be offered until yesterday. While I'm not opposed to hearing instrument specialists being able to see veterans through VA's community care network, I'm concerned that this amendment does not set forth the same qualification standards for community providers that VA has established for the hearing aid specialists that it provides. In response to a 2016 law that required VA to begin hiring hearing aid specialists, VA established a set of qualification standards. To practice at VA, these individuals must be under the supervision and direction of a licensed audiologist, be licensed and hold active board certification from the National Board for Certification in Hearing Instrument Sciences. I am concerned that Mr. Barrett's amendment would result in veterans being referred to less qualified providers in the community than they would otherwise be seen at VA. In addition, the section of Title 38 that would be amended by this measure does not list any other specific professions or occupations that are eligible to participate in VA's community care program, and I don't think it's wise to start doing that here. Right now, the law just says healthcare providers are eligible to provide VA's community care network, participate in VA's community care network if they participate in Medicare or work at the Department of Defense, Indian Health Service, federally qualified health centers, or meet, quote, criteria established by the Secretary, end quote. If we start naming certain professions, we run the risk of inadvertently excluding others. For this reason, I must oppose the amendment, but I would be interested in working together with Representative Barrett on a bipartisan basis to improve this legislation so that it can be considered at a future markup. I yield back, Mr. Chairman.
Does anyone else seek recognition? Somebody need. Representative Bradwagon.
Mr. Chairman, I'd like to yield to Mr. Barrett.
You're recognized.
Thank you, Mr. Chairman. Appreciate the ranking member's willingness to work on this. I would just stipulate that licensed professionals are, of course, licensed by their individual jurisdictions in which they are located, so we don't do scope of practice licensing through this body, of course, so these are required to be licensed in the jurisdiction in which they are located, which I think is the extent to which we can determine the professional qualifications of an individual. I appreciate the concern about making sure that we are handling this in the appropriate manner, and I obviously support my amendment and I urge its adoption, but I am willing to work, of course, in a good faith effort toward resolving any further concerns you have. We'd had some challenges getting responses from some of your office in the past, and I look forward to working with you to make sure that we can sew this together in the way that makes you comfortable. So appreciate it. Thank you.
I appreciate that offer. Thank you.
Any others? Seeing none, the question occurs on agreeing to the Barrett amendment to the amendment in the nature of a substitute. All those in favor say aye. Aye. All opposed say no.
No.
In the opinion of the chair, the ayes have it. Without objection, the motion to reconsider is laid on the table. I now recognize Representative Dr. Conaway to offer an amendment number 1 to an amendment in the nature of the substitute.
Yes, Mr. Chairman, I have amendment to the amendment in the nature of a substitute at the desk.
The clerk shall report the amendment.
Conaway Amendment Number 1, amendment to the amendment.
I ask unanimous consent that further reading of the amendment is dispensed with. Without objection, so ordered. The gentleman is recognized for 5 minutes to explain his amendment.
Thank you, Mr. Chairman. My amendment would require community care providers to receive necessary training at the VA. If a community care provider fails to comply with the required training and deadlines, that provider would be temporarily suspended from treating veterans. Time after time, we have heard from veterans that community care providers have missed symptoms or struggled to connect a symptom to a veteran's time and services due to lack of familiarity with the veteran or military, active duty, retired demographic. It's not a surprise that medical staff who do not exclusively serve veterans or those who have not served in the armed forces may face challenges in understanding the physical, mental, and emotional stresses that come with military service. As members of this committee, it is our responsibility to ensure that any physician, nursing assistant, or other direct care medical staff that comes in contact with a veteran has foundational knowledge that is necessary to detect and connect symptoms to service and provide appropriate treatment. By requiring community care providers to undergo training, we're giving them the crucial insight that they need to deliver the best possible care to veterans. I would note that this amendment holds community care providers to the same standard as VA health care or direct care service providers. If you're serving the VA, you have to undergo training that is specific and tailored to meet the needs of the veteran. We should require community providers to do the same, to undergo the same training, so that they can provide exceptional care to our veterans. This training would be would be free. It could be done remotely, and would last just an hour. Of course, it's noted that perhaps the Secretary might provide additional training beyond this, but we want to make sure that there's parity between those healthcare providers who work and serve in the VA, that there's parity between those providers and the community providers that may and will continue to care for our veterans. I hope all my colleagues will join me in supporting this much-needed amendment, and I yield back.
The gentleman yields back, and I recognize myself in opposition to the amendment. Every minute of red tape providers have to comb through takes away from the patient care. This amendment from the other side of the aisle would force providers to put time into special training courses instead of veterans. We should make it easier, not harder, for doctors to see veterans. If a veteran wants community care, the veteran should get it. If a veteran wants direct VA care, the veteran should get it. Many providers already do right by veterans because they do right by their patients. We should let doctors be doctors. I oppose this amendment. Does any other member wish to speak on the amendment? Seeing none. The question occurs on agreeing to the Conaway Amendment number 1 to the amendment on the nature of a substitute. All those in favor say aye. Those opposed, no. No. In the opinion of the chair, the noes have it. Without objection, the motion to reconsider is laid on the table. A recorded vote has been requested pursuant to committee rules. This vote will be postponed. I now recognize Representative Morrison to offer an amendment to the amendment in the nature of a substitute.
Thank you, Mr. Chairman. I have an amendment to the amendment in the nature of a substitute to H.R. 740 at the desk.
The clerk shall report the amendment.
Morrison, Amendment number 2.
I ask unanimous consent further reading of the amendment be dispensed with, and without objection, the gentlelady is recognized for 5 minutes to explain her amendment.
Thank you, Mr. Chairman. My amendment would require VA to update its public directory of community providers to include information on which providers have taken VHA's 1-hour introductory training course on veteran care. My amendment would also push providers who have taken this training to the top of the search results. VHA offers a course for community providers to improve their competency in treating conditions that disproportionately affect veterans, including mental health conditions, TBI, PTSD, and military sexual trauma. This training also provides an introduction to military culture, so providers can learn about how identification with military culture can play a role in patients' perception of injury and illness and can influence the response to treatment. By incentivizing community providers to complete this training course, which can be done in just an hour, we can help ensure that our veterans always get the high-quality care they deserve, whether at VA or in the community. As more veterans receive care in the community, we should make sure that the veteran has all the necessary information to make an informed decision about which community provider is best suited to treat them and understand their unique needs. I urge my colleagues to vote yes on the amendment, and with that, I yield back. Thank you, Mr. Chairman.
The gentlelady yields back. I recognize myself in opposition to the amendment. The amendment would create more burdens for community providers. It is my understanding the VA may already be looking to do some of this in the next round of contracts for the community care, but I leave it up to the negotiations between the VA and the contractors that they award. This amendment does not belong in legislation, and I oppose it. Does any other member wish to comment? Seeing none. The question occurs on agreeing to the Morrison amendment and amendment in the nature of a substitute. All those in favor say aye. Aye.
Aye.
Those opposed, no. No. In the opinion of the chair, the noes have it.
Mr. Chair, I ask for a recorded
A
vote.
recorded vote has been requested pursuant to rules. This vote will be postponed. I now recognize Representative Conaway Dr. Conaway to offer an amendment to number 9 to the amendment in the nature of a substitute. The clerk shall report the amendment.
Conaway Amendment
I
Number
ask
9.
unanimous consent. The further reading of the amendment is dispensed with without objection, so ordered. The gentleman is recognized for 5 minutes to explain his amendment.
Thank you, Mr. Chairman. My amendment adds a new section to the ANS which would require the VA to establish a fee schedule for community providers of residential substance use disorder treatment. Under the Mission Act, the VA typically pays Medicare rates for community care. However, Medicare does not cover residential substance use disorder treatment. And in more than 7 years since the enactment of the Mission Act, the VA has never established its own fee schedule for this service. Instead, the VA has been reimbursing community providers of residential rehabilitation as a percentage of billed rates. In some cases, the VA has been paying these providers $6,000 a day. For the 20,000 veterans who receive residential rehab in the community between fiscal years 2021 and 23, the VA paid an average of $69,000 per referral. Because of this, many community providers engage in predatory marketing practices targeting veterans. When they see veterans, they see dollar signs. Late last year, the VA's Office of Inspector General issued a fraud alert warning veterans and the public that certain drug and alcohol rehabilitation facilities are attempting to exploit veterans for profit. In May this year, the Department of Justice announced that it had secured a civil settlement of $19.75 million from Seabrook House, a New Jersey drug and alcohol rehabilitation center. The settlement resolved allegations of submitting false claims for payment to the VA's community care program and New Jersey's Medicaid program in connection with drug and alcohol abuse treatment. VA's Office of Inspector General is continuing to investigate similar allegations against other rehab providers elsewhere in the country. In addition to creating an incentive for community providers to exploit veterans for profit, not having a fee schedule for residential rehab places the VA at risk of significantly overpaying for these services. That is wasteful and is simply not sustainable for the VA to continue paying for these services at these astronomically high rates. The VA is currently paying far more than Medicaid or any commercial insurer pays, and community providers are capitalizing on it. VA officials have assured the committee staff that they have been working to establish a fee schedule, but the department has yet to do so. My amendment would require the VA to establish a fee schedule for residential substance use disorder treatment within 180 days of enactment. I urge my colleagues to support this amendment, and I yield back.
The gentleman yields back, and I recognize myself in opposition to the amendment. The amendment is unnecessary as a fee schedule for VA's community care providers is already published annually on their community care website. My staff would be happy to connect with your staff and after markup to show you where you can find it. Does any other member wish to comment?
Yes, Mr. Chairman.
Ranking member.
Mr. Chairman, there may be some misunderstanding about what the community care fee schedules do in fact publish. They establish fee schedules for other types of care, but for residential substance abuse treatment, they have not published those fee schedules. I would ask that we be made privy to this if this is true, but this is an extraordinary problem that the providers of substance abuse treatment set their own fees and can bill VA and get paid for it. This is an incredible situation, and it opens up the veteran to being targeted for all sorts of abuse. There is a fee for dental, for example. There's a fee schedule for dentists, but not for residential rehabilitation for substance abuse. And I would think any provider in America, any common sense citizen who's dealt with any pre-negotiated fees for how much their health plan will pay for something would be surprised to find out that VA does not have a set fee schedule for the providers of residential substance abuse treatment.
So, you yield back.
I would just say, Mr. Chairman, I think this amendment is a very common sense amendment, and most Americans would say this is crazy to allow providers to bill VA for whatever they want and get paid for it.
Thank you for your comments. Anybody else? Okay. And that being said, no one seeking recognition. The question occurs on agreeing to the Conaway amendment to the amendment in the nature of a substitute. All those in favor say aye.
Aye.
All those opposed, no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to. With it, according a record code vote having been requested pursuant to committee rules, the vote will be postponed. Because votes are pending on this bill, we will move to consider of the next bill on the agenda. I now call up H.R. 1663, the Veterans Scam and Fraud Evasion Act of 2025. The clerk shall report.
H.R. 1663 to
The
amend
text was
Title...
circulated in advance and pursuant to committee rules without objection. The first reading is dispensed with, and the bill is now open for amendment at any point. I now recognize Representative Kiggins for the purpose of offering an amendment to the nature of a substitute.
Mr. Chair, I have an amendment in the nature of a substitute at the desk.
The clerk shall report the amendment in the nature of a substitute.
Amendment in the nature of a
I
substitute.
ask unanimous consent that further reading of the amendment as nature of substitute is dispensed with, and I ask that it be considered base text for the purpose of this markup and without objection so ordered. I now recognize Representative Kiggins for 5 minutes to speak in support of the amendment in the nature of a substitute.
Mr. Chair, my amendment in the nature of a substitute would make technical changes to update the language in H.R. 1663 introduced by my friend and colleague, Representative Ken Calvert. This amendment would consider the feedback we received from the VA to ensure that if this bill becomes law, the fraud website and support hotline would work the way we want it to. My amendment includes the name of the website, which is vsafe.gov. Another technical change provided by the VA was to include the name of the vSafe fraud hotline in the legislation. I also want to use this opportunity to share the number of the hotline if this may be helpful for any veterans watching. The number is 833-388-7233. 833-388-7233. I worked with the VA to ensure that this amendment would utilize the existing resources to guarantee there is no hiccup and veterans are getting the most up-to-date information when they need it. This amendment also includes language that would ensure that we are being responsible with taxpayer dollars by only introducing programs that Congress can pay for. This amendment would support the intent of Representative Calvert's legislation. The VA must provide a central location where veterans and their families can seek guidance and notifications to protect themselves against deceitful tactics. The phone number and hotline would offer 2 avenues for veterans to report these attempts when they happen and also to gather information to protect themselves. This office is so crucial to ensure that our veterans are protected against sophisticated scam artists and fraudsters. This effort at the VA would help families stay vigilant when veteran benefits are at the risk of being scammed. I urge my colleagues to support my amendment in the nature of a substitute, and I yield back.
Gentlewoman yields back. I now recognize myself in support of the amendment. I strongly support the amendment in nature of substitute offered by Representative Kiggins. The vSafe bill is a good, limited government solution to address the confusing bureaucracy that has plagued VA's fraud prevention efforts. vSafe would designate a single expert to connect veterans with pre-existing fraud prevention programs across the federal government with VSOs and in the private sector. It would not create a huge bureaucracy to replicate these efforts. With that, so many agencies already have. It would simply help veterans find the right place to learn more about fraud prevention and find the right office to help them where they're in trouble. Veterans deserve streamlined, up-to-date information when they reach out to VA about identifying theft, benefits, fraud, and other serious scams. This amendment clarifies vSafe is designated central point for reporting veterans' specific fraud and will improve outcomes for veterans. I'm pleased to support Representative Kiggins' amendment in the nature of a substitute, and I urge my colleagues to vote yes. Do any other members wish to have comment on the amendment in the nature of a substitute to H.R. 1663? Are there any amendments to the amendment on the nature of a substitute to H.R. 1663? I now recognize Representative Ramirez for the purpose of offering an amendment to the amendment in the nature of substitute for H.R. 1663.
Thank you, Chairman.
You have an amendment at the desk?
Oh, yeah, sorry, I'm getting ahead of myself. Yes, I have an amendment at the desk.
The clerk will report.
Ramirez Amendment Number
I ask
1.
unanimous consent that further reading of the amendment is dispensed with it, and without objection so ordered. I now recognize Representative Ramirez.
Thank you, Chairman. As we all know, scam artists seem to be multiplying, and so many of us know someone or have been victims of identity theft. My amendment would require the Veteran Scam and Fraud Evasion Officer to develop an issue targeted training specific to the most common scams and fraudulent activities facing our veterans and their families today. My amendment is not only appropriate, it's also urgently needed. The evidence is clear. You probably have seen those text messages that come up. You've probably seen those emails that are attempting to steal our veterans' data or our own families' data. According to the Federal Trade Commission in 2024, veterans reported some of the highest numbers of fraud complaints and the greatest total losses in 2024. As a matter of fact, do you know how much that was? $419 million. Veterans also continually face higher individual losses than the general population. Their median losses are around $700, which is actually over $200 higher than the non-veteran individual reporting to the Federal Trade Commission. Both the FTC and the VA, through the V-Safe program established under President Biden, have narrowed in on several of the most common scams and fraudulent activities targeting veterans and their families, which actually include imposter scams, which account for nearly 40% of the military and veteran community's fraud losses. These scams are those that seek to impersonate others, whether it be that they say that they're government officials, technology support, or even scamming them saying that they're close family members or love interests to collect money or gain access to veterans' personal systems. The other is this multi-level marketing scheme and other business opportunities that they get emails or text messages about. Also regularly targeting veterans, specifically service members and their families, under the guise of patriotism, flexible hours, or even telling them that this will gain them financial independence. However, many of these opportunities ultimately result in little to no profit, and in more instances than not, it ends up being significant debt. Veterans are specifically targeted to join MLMs because their VA benefits can be a source of capital and their network of veteran peers a source of referrals for them. And look, it is wrong for veterans to be targeted for their capital networks when less than 1% of MLM participants ever make a profit from those opportunities. Our veteran service organization partners are heavily involved in this area, raising awareness to fraudulent activity relating to veteran benefits like pension poaching, disability benefits, preparation scams, and the DBQ fraud. Implementation of this amendment would require the Veteran Scam and Fraud Evasion Officer to develop trainings and awareness campaigns directed on these top scams and to help provide veterans and their families with clear, actionable guidance to protect their benefits. Part of delivering on our promise to veterans is ensuring that they're protected from these bad actors, seeking to exploit them from their benefits that they have so hard work to earn. I urge all of my colleagues to join me in supporting this amendment. And with that, Chairman, I yield back.
The gentlelady yields back. I now recognize myself in opposition to the amendment. I stand in opposition to this amendment because it would restrict the Secretary's ability to determine what V-Safe officers' responsibilities would be. The decision should be left up to the VA Secretary, not Congress, to protect veterans' needs. As scammers evolve and become more severe, the Secretary will need the ability to adapt without being restricted by the political climate at the time. For these reasons, I oppose this amendment, and I encourage all of my colleagues to do the same. Does any other member wish to comment on the amendment to the amendment in the nature of a substitute? Thank you, member.
Yes, Mr. Chairman, the MLM, multi-level marketing schemes, are a scourge on our military service members and the veterans that are known to be beneficiaries of disability pensions. And it is unconscionable, in my mind, that we do not arm these veterans with the information about what these scams do. Especially, we know statistically what was, Ms. Ramirez, if you could answer my question, you said 1%? 1% succeed at these offers, and they're marketed as, I've seen these marketing come through, work at your own schedule, set your own hours. These are all the sort of techniques to draw veterans in. I yield to you to respond.
Yeah, and thank you, Ranking Member. I mean, you heard me tell you at the beginning, $419 million. That is the greatest total loss that veterans have received in scams. And in 2024, we reached that level. They are the ones scammed at the highest level in our country. And what this amendment does, Chairman, what it specifically does, it says Congress understands what our veterans are going through. We want to ensure that we're protecting them from all these scams. And certainly from people who are lying to them about what money they're going to make. And all it does, it requires the Veteran Scam and Fraud Evasion Officer to develop trainings, awareness campaigns, so that their families know what they're being targeted for. That can't be political. That's about providing awareness and training for every single veteran, regardless if they have an R, a D, an I, a I don't care about politics. So I think it's really discouraging when I hear people say that trying to protect our veterans from being victims of fraud is a political thing. And in a time where Congress needs to be better at specifically guiding those protections for our veterans, this amendment will help do that.
I'm reclaiming my time. This amendment does not unduly burden the Secretary or restrict the Secretary. We point out specific scams that the Secretary give guidance about through the V-Safe officer. And the statistics are pretty damning. The significantly higher rate of victimization of veterans who are the targets of these multi-level marketing schemes. The fact that the veterans have their own community, and the proliferation of the victimization when veterans who are ensnared into these schemes start to target their fellow veterans to be part of this. I can't believe that this committee would not take an interest in attempting to educate all of our veterans, especially those veterans that are in disability pensions, about the financial harm and danger that these multi-level marketing schemes pose. And Mr. Chairman, I yield back.
Gentleman yields back. Any other comments? Questions? Seeing none. The question occurs on agreeing to the amendment in nature of substitute to H.R. 1663. All in favor say aye.
Aye.
All those opposed, no. No. And the noes have it, and the amendment in the nature of
Mr.
substitute.
Chair, I request a recorded vote.
A recorded vote having been requested in accordance with the Rules Committee, further proceedings on this matter will be postponed. Are there any further amendments to the amendment in the nature of the substitute to H.R. 1663? Hearing none. No? Save that one. The difference. Are there any further amendments to the amendment nature of substitute for H.R. 1663? Hearing none, the question now. Nope. Where am I going to? Okay. So we will, because there is an amendment vote pending, we will move to the next bill. Be considered later. I now call up H.R. 3400, the Travel Act of 2025. The clerk shall report the bill.
H.R. 3400, to amend Title 38,
The
United
bill
States.
was circulated in advance and pursuant to committee rules without objection. The first reading is dispensed with, and the bill is open to any amendment at any point. I now recognize Representative King-Hines for the purposes of offering an amendment in the nature of a substitute.
Mr. Chairman, thank you. I have an amendment at the desk.
The clerk shall report the amendment.
Amendment in the nature of a substitute.
I ask unanimous consent that further reading of the amendment in the nature of a substitute be dispensed with, and I ask that it be considered base text for the purpose of this markup and without objection so ordered. I now recognize Representative King Hein for 5 minutes to speak in support of the amendment in nature of a substitute.
Thank you, Mr. Chairman. Before I do so, I want to go on record to express my deepest condolences to the people of the Commonwealth on the untimely and shocking passing of our governor. Thank you for the opportunity to speak on my bill, H.R. 3400, the Territorial Response and Access to Veterans Essential Life Care Act, or the Travel Act of 2025. In the Commonwealth of the Northern Mariana Islands, there's only one part-time physician serving hundreds of veterans spread across 3 islands. When our veterans need specialized care, they're told to travel thousands of miles to Guam, Hawaii, or the continental United States, sometimes at their own expense and with no guarantee of timely appointments. This is not just a logistical failure, it's downright shameful. Veterans should never have to book international travel, pay out of pocket, or delay life-saving care because of where they live. And they certainly should not be forced to choose between their health or their financial well-being. The Travel Act is a necessary step toward correcting this inequity. It establishes a program within the VA that deploys specialists to the territories for periods of up to 1 year. With my amendment in the nature of a substitute, this legislation enables the Veterans Affairs to begin its long journey in remedying the medical desert our veterans face throughout all of the territories. This legislation recognizes that service is service regardless if a veteran lives in Saipan or San Diego. Thank you, Mr. Chairman. I yield my time.
The gentlelady yields back. I now recognize myself in support of the amendment. More than 100,000 veterans live in the U.S. territories, but there is a huge gap in health care access for these veterans that oftentimes requires them to travel far and wide to see a medical provider. These veterans deserve better health care access to receive the good and safe care they have earned. Representative King Hein's bill would create a billet for the VA physician to serve U.S. territories and possessions. So this is a vitally important lifeline for our veterans communities that live in these territories. I thank Representative King Hein for her proposal to expand health care access. Do any other members wish to comment on the amendment in the nature of a substitute for H.R. 3400?
Mr. Chairman.
Yeah, Ranking.
Mr. Chairman, thank you. I'm glad to support Representative King Hein's bill, the Travel Act, which will ensure veterans living in the U.S. territories can access VA health care. The more than 100,000 veterans, as you said, living in the U.S. territories have long struggled to access VA health care due to a dearth of health care facilities near them. This legislation would allow VA to assign department physicians to serve as traveling physicians for the territories, therefore ensuring that a VA provider is available to provide care for those who need it. I appreciate Representative King Hein's tireless work to represent her constituents and ensure that veterans living in the Northern Mariana Islands and other territories have access to the care they need and have earned. I'm glad to support this legislation, and I yield back.
Does anyone else seek recognition on H.R. 3400?
Well, I just have a question, Mr. Chairman. Representative King Hines, is this only for the island territory, the Pacific territories, or would this also include, say, the Virgin Islands?
It's supposed to include all the territories.
All the territories. Okay. Well, this is really good news.
Anyone else? I now recognize myself for purposes of offering an amendment to the amendment in the nature of a substitute for H.R. 3400. The clerk shall report the amendment.
Bost
I
Amendment
ask unanimous consent for the reading of the amendment is dispensed with without objection so ordered. I now recognize myself to explain my amendment. My amendment is simple. It fully offsets the cost of the bill to protect the taxpayers. Does any other member wish to comment on the amendment in the nature of a substitute? Hearing none. The question now occurs on agreeing to the amendment in the nature of a substitute to H.R. 3400. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment is amended, and the nature of the substitute is agreed to. The motion to reconsider is laid on the table. Are there further amendments to the amendment in the nature of the substitute? Hearing none, the question now occurs on agreeing to the amendment in the nature of substitute to H.R. 3400 as amended. All those in favor say aye. Aye. Those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of substitute is agreed to. The motion to reconsider is laid on the table. I now recognize Ranking Member Takano for a motion.
I move that H.R. 3400, as amended, be reported favorably to the House.
The question is on favorably reporting H.R. 3400 as amended to the full House. All those in favor say aye. Aye.
Aye.
Those opposed, no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 34 as amended is reported favorably to the House.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority supplemental additional or dissenting views on H.R. 3400 as amended.
Without objection, the motion to reconsider is laid on the table. I now call up H.R. 2605, the SAVES Act. The clerk will report the bill.
H.R. 2605.
Clerk shall report, the text has been circulated and in advance, and pursuant to committee rules without objection, the first reading is dispensed with, and the bill is now open for amendments at any point. And I now recognize Representative Luttrell for the purposes of offering an amendment in the nature of a substitute.
Mr. Chairman, I have an amendment at the desk.
The clerk shall report the amendment.
Amendment in the nature of a substitute to H.R. 2605.
I ask unanimous consent that further reading of the amendment in the nature of substitute be dispensed with. I asked it be considered base text for the purpose of this markup, and without objection so ordered, I now recognize Representative Luttrell for 5 minutes to speak in support of the amendment in nature of substitute.
Thank you, Mr. Chairman. Today I offer an amendment in the nature of a substitute to the Service Dogs Assisting Veterans, or SAVES Act. An important step forward towards improving veterans' access to service dogs, this legislation establishes a pilot program authorizing the Secretary to award competitive grants to nonprofits and provide service dogs to veterans who need them most. These service animals are a life-changing event, in my opinion. My identical twin brother has had one since he retired from the military. Service animals provide support for those in need of, that have lost their eyesight, for mobility issues, that have post-traumatic stress disorder, traumatic brain injury. But not only do they help the veteran, they also help the families. And as we move forward, I think it's important that we find those tools that you can put in your toolbox to increase your quality of life and decrease the symptomatic issues for those veterans who are suffering from things that they've brought back from the war. So I want to thank Mr. McGarvey for walking alongside me on this one. Really appreciate that, Morgan, the ranking member, and Mr. Chairman, I appreciate all the support on this, and with that, I yield back.
Gentleman yields back. I now recognize myself in support of the amendment. Under current law, VA does not provide service dogs, but does provide care and other benefits for service dogs. Service dogs help veterans deal with service-connected conditions. They can learn tasks to help veterans who need fiscal assistance, like opening doors and providing balanced support. Service dogs also are recognized signs of distress, wake veterans from nightmares, calm panic attacks, and provide proven to help reduce feelings of anxiety, isolation, depression in the veteran community. Representative Luttrell's bill would create a pilot program to award grants to provide service dogs to eligible veterans. Studies have shown that when paired with veterans, service dogs can mitigate PTSD symptoms by providing veterans with the help they might need. This is a good bill to look at what more we can do to improve mental health and wellness for our veterans. I want to thank Representative Luttrell for his proposal. Do any other members wish to comment on the amendment in the nature of a substitute for H.R. 2605?
Mr. Chairman.
Ranking member.
Thank you, Mr. Chairman. For many veterans, a relationship with a service dog is an important tool in their journey to full health. Whether they are assisting disabled veterans with daily tasks, improving independence, or an ability to navigate for veterans with mobility or sensory issues, or in some cases, just improving mood and mental health symptoms, service dogs add a lot of value to their owners' lives. And that's why I'm glad to support Mr. Luttrell's legislation, the SAVES Act today. This bill will authorize VA to offer a 5-year pilot program to provide service dogs to veterans. It also outlines crucial requirements and responsibilities for nonprofits that participate in the pilot program to ensure they are capable and engaged in providing service dogs. It also includes critical protections to ensure the nonprofits are accredited properly and treat the animals they work with humanely. For veterans that VA determines would benefit from a service dog, this bill will help facilitate more veterans receiving service dogs, and VA will assist with the expenses through veterinary insurance. The bond between a veteran and his or her dog can be very special. I am glad to support this legislation to ensure VA can help more veterans who need them have access to service dogs, and I yield back.
Gentleman yields back. Does anyone else seek recognition to make comments on H.R. 2605? Mr. Representative Sell.
Mr. Chairman, I rise to support my very understated colleague to my right. Dogs are indeed life-changing. You cannot overstate it. This is a results. This is what we ought to be about, producing results and not simply inputs to our veterans. Thank you, and I support it.
Any others? I now recognize myself for purposes of offering an amendment to the amendment in nature of substitute for H.R. 2605. The clerk shall report the amendment.
Bost Amendment number
I
1.
ask unanimous consent that further reading of the amendment is dispensed with and without objection so ordered. I now recognize myself to explain the amendment. My amendment to the SAVES Act would increase access to veterans to service dogs while also establishing a standard that providers must meet. The amendment would require that service dog providers demonstrate that they train their dogs in compliance with the American with Disabilities Act. This would ensure that there is a standard, but does not limit providers to only those who have time and resources to seek accreditation. In my own district, we have an organization called This Abled Vet, not disabled veteran, but This Able Vet. They are well known in our community and trusted to provide service dogs to veterans, but their program is very, very different from the type of program accredited by the Assistant Dogs International or the International Guide Dog Federation. As such, I recognize that not all providers that are best for veterans are going to fall under the same category. For that reason, I offer the amendment to Representative Luttrell's good bill. Does any other member wish to comment on the amendment in the nature of a substitute? Seeing none, hearing none. The question now occurs on agreeing to the amendment in the nature of a substitute to H.R. 2605. All those in favor say aye. Aye. All those opposed say no. In the opinion chair, the ayes have it. It is, and the amendment to the amendment in the nature of substitute is agreed to.
Mr. Chairman?
The motion to reconsider is laid on the table. We're still got just a second here. Are there any further amendments to the nature of substitute to H.R. 2605? Hearing none. The question now occurs on agreeing to the amendment in the nature of substitute to H.R. 2605 as amended. All those in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it. The amendment in the nature of substitute is agreed to. The motion to reconsider is laid on the table. You have a question?
Mr. Chairman, I'd just like to make a quick statement for about 5 seconds, if that's okay. This is actually, and I think this needs to be said out loud, because the VA actually came to my office about the SAVES Act and spoke with me directly and voiced their concerns, which I greatly appreciated. And then working across the aisle with Morgan McGarvey and then with leadership, this actually came together as it was supposed to come together. And I think moving forward with the veteran organizations that are supplying these animals with their input, and I think we have a great starting point with this legislation. Thank you. I yield back.
I now recognize the ranking member Takano for a motion.
Mr. Chairman, I move that H.R. 2605 as amended be reported favorably to the House.
The question is on favorably reporting the bill H.R. 2605 as amended to the full House. All those in favor say aye. 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 Opposed, no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 2605 as amended is favorably reported to the House.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority supplemental, additional, or dissenting views on H.R. 2605 as amended, and I congratulate my colleague, Mr. Luttrell.
The motion to reconsider, the gentleman, hold on. We're mad. Without objection.
Without objection.
Now, the motion to reconsider laid on the table. There we go. I now call up H.R. 3951, the Rural Veterans Improvement Access to Benefits Act. The clerk shall report the bill.
H.R. 3951 to
The bill
amend.
was circulated in advance and pursuant to committee rules, and without objection, the first reading is dispensed with, and the bill is open to amendment at any point. And I now recognize myself for 5 minutes to speak in favor of the legislation. The bill would extend the license portability authority for contracted medical professionals conducting compensation and pension examinations until 2031. The C&P exams are important, but they also extend an already lengthy process. This problem is made even worse when veterans are forced to travel far distances for their exams. Congress created the temporary license of portability to extend examinations authority to a wider variety of contracted medical professionals who have expertise in performing the C&P exams. By ensuring more contract medical professionals are able to perform C&P exams, VA is better able to serve veterans in underserved and rural communities. We cannot allow this program to sunset. It is a lifeline for our nation's remote veterans and who often live hundreds of miles away from a VA facility and near only a small number of medical professionals. This bill would also expand the eligibility specialties of contracted medical professionals currently covered. Under current law, license portability only applies to physician assistants, nurse practitioners, audiologists, and psychologists. This bill would expand the authority to include providers who are eligible for employment in certain healthcare positions in the VHA. This is a necessary expansion to the C&P exam program. If a medical professional would be eligible for employment at the VA healthcare facility, they should also be able to serve veterans closer to their home. This bill would also require VA to submit a report to Congress on the frequency, timeliness, legal adequacy, and associated cost of C&P exams performed by contractors. I thank Representative Scamani for his leadership on the bill and his efforts to increase accessibility to exams for our nation's veterans. Does any other member wish to comment on the bill? Seeing none. Does any member wish to offer an amendment to H.R. 3951?
Mr. Chairman, I have an amendment.
I now recognize Representative Ramirez to purposes of amendment. You have amendment at that.
Thank you, Chairman.
You have
I
an
have an
amendment.
amendment at the desk.
The clerk shall report the amendment.
Ramirez
I
Amendment
ask
number
unanimous
1.
consent that further reading of the amendment is dispensed with without objection, so ordered. I now recognize Representative Ramirez for 5 minutes to speak in support of the amendment.
Thank you, Chairman. My amendment would reverse the illegal and immoral actions taken by President Trump and Secretary Collins that effectively revoked collective bargaining rights from thousands of VA employees. As we learned yesterday at my Oversight and Investigation Subcommittee hearing, the VA needs to do more, not less, to make the agency a place where people want to work and they want to grow their careers. I'm alarmed by the level of attrition we are seeing at the VA from veteran-facing employees. Let me tell you a little bit more about that. Over 7,500 doctors, nurses, psychologists, claim examiners, and more have left the VA on their own volition since the beginning of the fiscal year. These are employees who could not partake in the deferred resignation program or early retirement. I want to be very clear that the employees who are leaving are not employees subject to the hiring freeze. Let me say that again. The employees who are leaving the VA are not employees subject to the hiring freeze. They are leaving on their own because under the leadership of Secretary Collins, the VA has become for them a hostile and toxic environment for its employees. The level of loss we're documenting is not sustainable if we intend to deliver the benefits and care our veterans have earned and they deserve. Furthermore, the loss of VA employees will impact the delivery of care and benefits for veterans, and it's already negatively impacting veterans' experience, regardless of what the Secretary continues to claim. Workplace rights, including the right to collectively bargain, have been enshrined in the law for decades. Unions make VA a better place to work and a better place for veterans to receive their care, period. When implementing President Trump's executive order that aimed to abolish collective bargaining at the VA, Secretary Collins, in essence, made it clear that he was going after his and Trump's political enemies. Simply put, some employees at certain facilities would get to keep their collective bargaining agreements, while others who may work at a VA down the street would not. I mean, how do we decide? Loyalty to the administration? That is completely unacceptable and is just another way that this administration seeks to suppress resistance and dissent. Trump and his Justice Secretary Collins are deciding that the unions that dared challenge the president in court were to be stripped of their worker rights. The rights that, I may add, were enshrined in legislation by this Congress. I will not stand by while the rights of VA workers who show up day in and day out to care for our veterans are trampled on. I'm not going to stand by and watch the continued demonization and demoralization of the VA workforce. And it's why I'm offering this amendment today to make it clear that this committee demands the reinstatement of collective bargaining rights for every VA worker. I urge all my colleagues to vote yes on my amendment. And with that, Chairman, I yield back.
The gentlelady yields back. I recognize myself in opposition to the amendment. This amendment would reinstate the Federal Workers Collective Bargaining Agreement with the VA that was terminated by the President's March executive order. As a union firefighter, I have long recognized the need for strong labor relations. However, I believe it is inappropriate for Congress to weigh in on this matter or tie the hands of the Secretary during an ongoing litigation. This amendment is a poison pill that would risk the passage of this very important underlying bill. I will vote no on this amendment, and I urge my colleagues to do the same. Does any other member wish to comment? Ranking member.
Yes, Mr. Chairman, and before I begin my comments, I just want to have the record reflect that the author of H.R. 3951 is not present at the committee, and we're setting a precedent here whereby we can continue with the business of the markup with that fact. I would just say we hope that, that in the future that there'll be a similar consideration for the minority in cases like this. I will keep my comments brief in support of Congresswoman Ramirez's amendment, but I do feel compelled to buttress her sentiments. When I was a public school teacher, I was a member of a union, as you were a member of the firefighters union. I know firsthand the power of unions and the important role they serve to protect workers' rights. VA is losing employees at a record pace, and it isn't just losing employees to the deferred resignation program or early retirement. Veteran-facing employees. So we're not just talking about the doctors and nurses who face veterans, but it's the doctors, nurses, and claims examiners, police officers, and social workers. These are also veteran-facing employees, not just the doctors and nurses, but claim examiners, police officers, social workers. They're leaving in droves due to the working conditions of VA. A net 7,500 of these mission-critical employees have left VA on their own volition in this fiscal year. I worry that working conditions are leading these employees to choose to leave their jobs at VA. Without unions to help address the workplace concerns that they have, I fear these employees are left with few avenues of redress and are stuck choosing between staying in a toxic work environment and leaving a job they love. The right to collectively bargain, sir, is the law, and it is absolutely Congress's role to ensure that the president and his appointees are following the law. And to try to wash our hands of it and say, well, we don't want to interfere with the secretary and all of that. No. It is our job as the Oversight Committee to ensure that the Secretary follows the law. And the right to collectively bargain is the law. And to do less is to step back and allow the executive to do things outside the law. The right to collectively bargain is also integral to improving working conditions, to VA's ability, to improve working conditions such that VA's ability to recruit and retain employees is enhanced. There is simply no denying that good working conditions are tied to collective bargaining. Veterans deserve a strong VA that is fully staffed by employees who feel empowered and supported by its leadership. I urge my colleagues to vote yes on Congresswoman Ramirez's amendment to restore collective bargaining agreements at VA, and with that, I yield back.
Anyone else seeking recognition? Ms. Brzezinski.
I just want to voice my strong support for Congresswoman Ramirez's amendment. I, too, want to just echo what our ranking member said, that collective bargaining rights are the law, and it is something that is critically important that we make sure as a committee is being enforced. We know that collective bargaining and the erosion of it at the VA is largely contributing to the morale issues that I hear about in my district. The fear, the toxic environment, the direct assault on collective bargaining rights of the workers that are at the VA, I think is contributing significantly to that environment and leading to a lot of employees leaving in droves, those same employees that we really need to administer the benefits that the veterans have deserved. And I lastly just want to point out that, you know, a lot of the workforce within the VA are veterans themselves. And I think that's a really important point, that those veterans deserve the right to have collective bargaining, just like all the other workforce employees do at the VA, but that this is critically important to maintaining morale and a good work environment to help provide services to our veterans. So thank you. I yield back.
Anyone else seeking recognition? Seeing none, the question now occurs on agreeing to the Ramirez Amendment Number 1 to H.R. 3951. All those in favor say aye.
Aye.
Opposed say no. No. In the opinion of the chair, the noes have it. The amendment is not
Chairman.
agreed to.
I request a recorded vote.
A recorded vote being requested is in accordance with the committee rules. Further proceedings on this matter will be postponed. I recognize Representative Ramirez for the purpose of offering Ramirez Amendment Number 2.
Chairman, I have an amendment at the desk.
The clerk shall report the amendment.
Ramirez Amendment Number 2, amendment to H.R.
I ask unanimous consent that further reading of this amendment is dispensed with, and while objection so ordered, I now recognize Representative Ramirez for 5 minutes to speak on the support of her amendment.
Thank you, Chairman. This amendment specifically would bar VA from contracting with any company with which a special government employee, you know the kind of employee I'm talking about, has a financial interest. Over the past several months, we have witnessed the rampant corruption of individuals, including in DOGE. These individuals were given access to sensitive information. They made reckless decisions across the agency, and they put thousands of people at risk. This kind of rogue behavior is appalling, and it should concern every American taxpayer and certainly every single member in this committee. Did I get ahead of myself because I want to protect the
you're on the
people
wrong amendment,
from
yeah. I'll have to restack my response.
You're gonna have to. Wait a minute, I wasn't ready for that one, right? Oh, sorry. They were together.
Yeah. Okay. How about you're recognized for this amendment?
So the question is, can you restore me back to 5? I appreciate that grace. Thank you. All right. So do we need a, Chairman, I have an amendment at the desk.
The clerk will clarify, yes, we'll designate the amendment.
Ramirez Amendment Number 2, Amendment to H.R. 3951.
I ask unanimous consent for the reading of the amendment is dispensed with without objection, so ordered. I now recognize the Representative Ramirez for 5 minutes to speak on this amendment.
Thank you. I might even go under 5, just as a thank you here. Thank you, Chairman. More than once, I've called this committee to recognize the diversity, the beautiful diversity of our veterans. And the diverse veterans in the communities that we represent need access to the full benefits that they have earned and deserve. This amendment specifically addresses equity and access to benefits for all of our veterans. In the past 6 months, the administration has waged a war on equity, trying to make the word taboo and to roll back the progress we've made to ensure equal access to federal programs and services. The administration has made excuses when veterans who have worn the uniform, have put their lives on the line, go without access to benefits and services that they were promised. Who am I talking about, you may be asking yourself? Well, I'm talking about people of color. I'm talking about women. I'm talking about immigrants, yes, because there are veterans who've been deported. LGBTQ plus folks, the elderly, individuals that live in rural communities, and all the other veterans who served and earned their veterans. Too often in this committee, my colleagues talk about how important data is to effectively and comprehensively address the problems that the department is addressing. Yet, this administration has eliminated many of the offices and positions focused on collecting and analyzing data to address where gaps may exist in the VA care and benefits for veterans, especially for diverse veterans. One of the offices Secretary Collins has chosen to shutter is the Office of Equity Assurance. We call it the OEA. This office was established following a 2023 GAO report that found that Black veterans' benefit approval rates had a persistent bias in disability compensation. Since the OEA was established, it has made efforts to address data gaps for veterans, conducted outreach in rural communities, and forged partnerships with academic affiliates to increase the VA's capacity to reach these areas. However, following President Trump's executive order targeting diversity, targeting equity, and targeting inclusion across the federal government, this office was actually closed. OEA's employees have been placed in administrative leave by Secretary Collins. This decision to close the office has not resulted in cost savings or liberation from radical ideology, as they call it, but instead it condemns us to ignorance by ensuring we have even less insight into where the gaps for VA care and benefits are. But perhaps that's the point. What this amendment does, it calls for the immediate reinstatement of the Office of Equity Assurance and its employees. With my amendment, I am also calling for the Office of Equity Assurance to resume the critical work it has done to address disparities in benefits, disparities in outreach, and other services that the VA provides, ensuring each and every single veteran gets what they have earned should not, and friends, it cannot be political. I urge all of my colleagues to join me in supporting this work to reach veterans who I know reside in each and one of our districts. And with that, Chairman, I yield back.
Gentlelady yields back. I recognize myself in opposition to the amendment. This amendment would direct the Secretary to permanently reinstate the VBA Office of Equity Assurance and require biannual congressional briefings. I support efforts to ensure that VA provides the highest quality service to all veterans. But veterans is a veteran is a veteran. We all proudly fought for the same flag and fought to protect the same freedoms. When veterans return to civilian life, it is the VA's responsibility to meet veterans where they are. I do not support forcing the Secretary to reinstate an office that would divide veterans. Equity is not equality. As a Marine, I know a rising tide lifts all ships. Veterans deserve a VA that champions the equality they fought for. I trust Secretary Collins' view that this office hinders our mission of serving our nation's diverse veterans and survivors. I will vote no on the amendment, and I urge my colleagues to do the same. Who else, does anyone else seek recognition? Ranking Member.
Thank you, Mr. Chairman. So in May, I hosted a roundtable that discussed many of the topics impacting minority veterans, and one of which was the closure of the Office of Equity Assurance, or OEA. It was extremely apparent from this gathering of 12 organizations and several former VA employees that OEA was doing incredibly valuable work to reach not only veterans of color, but women veterans, those in rural communities, and in many cases, veterans who are not connected to VA care or services. It is absolutely imperative that the Office of Equity Assurance and its employees are reinstated and are able to resume their critical work. I urge all of my colleagues to support Congresswoman Ramirez's amendment in giving VA the resources to reach all veterans where they are. I yield back.
Gentleman yields back. Does anyone else seek recognition? Seeing none. The question now occurs on agreeing to Ramirez Amendment Number 2 to H.R. 3951. All those in favor say aye. All opposed, no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to. The motion to reconsider is laid on.
I request a recorded vote, Chairman.
A recorded vote has been requested in accordance with the committee rules, and further proceedings on this matter will be postponed. Are there any further amendments to H.R. 3951? Seeing none and hearing none, it is now in order to consider the next bill because the amendments are pending votes. So I now call up H.R. 3483, the Fraud Act. The clerk shall report the bill.
H.R.
Text was
3483.
circulated in advance and pursuant to committee rules without objections. The first reading is dispensed with, and the bill is now open for amendment at any point. I now recognize Representative Barrett for the purposes of offering an amendment to the nature of a substitute.
Thank you, Mr. Chairman. I have an amendment at the desk.
Clerk shall report the amendment in the nature of a substitute.
Amendment in
I
the
ask unanimous consent that further reading of the amendment in the nature of a substitute be dispensed with, and I ask it to be considered base text for the purposes of a markup. Without objection, so ordered. I now recognize Representative Barrett for 5 minutes to speak in support of the amendment in the nature of a substitute.
Thank you, Mr. Chairman, and thank you for your consideration of this legislation today. The amendment before us in the nature of a substitute would make technical changes to my bill, H.R. 3483, the Fraud Act. This amendment would expand the purpose of the information technology system to detect waste, fraud, and abuse in all VHA programs instead of just one. This is specifically designed around community care invoices that are sent to the VA and billing that is done that way. It would also make technical corrections and provide an offset so this bill is cost neutral and fiscally responsible. We made these changes to this bill after hearing testimony from the VA at a recent Oversight and Investigation Subcommittee legislative hearing, bringing light to the need for this legislation. I appreciate the administration's dedication to combating the problems within the VA. This bill will save taxpayer dollars from being wasted on fraudulent, inaccurate, or otherwise misleading health care claims that have been submitted to VA. We've all seen horror stories about billing practices that have been done in a fraudulent way. Just last year alone, in fiscal year 2024, it's estimated that a total over $400 million in community care claims was done fraudulently, or improper in other fashions. This would direct VA to acquire a system designed to monitor third-party claims from healthcare providers and ensure that the department only pays accurate and complete claims, protecting the VA, veterans and their health care, the taxpayers, and the VA's reputation in the process. In VA's testimony on the Fraud Act, I was pleased to hear that the department estimates the savings generated from preventing overpayment will more than pay for this technology and fully recover all costs in perpetuity going forward. This wouldn't just stop bad actors from stealing veteran benefits, but would also save taxpayer money that we can reinvest back into services that veterans deserve. This legislation will protect the benefits that veterans earn and rely on, ensuring that VA is spending resources appropriately. VA IT systems must be modernized, and the subcommittee that I'm pleased to chair, the Technology Modernization Subcommittee, will continue finding ways to do that. I urge my colleagues to support my amendment in the nature of a substitute. And with that, Mr. Chairman, I yield back, and thank you again.
Gentleman yields back. I now recognize myself in support of the amendment. VA process billions of dollars in health care claims submitted by private providers every year. However, VA ineffective and broken fraud monitoring systems have left taxpayer dollars vulnerable to waste, fraud, and abuse. And without modern tools in place, VA cannot ensure taxpayers' investments is spent properly. This amendment would ensure VA has the technology to process claims in an honest, accurate, and legitimate manner. And I urge all members to support it and give VA the tools to move the agency forward. Do any other members wish to comment on the amendment in nature of substitute for H.R. 3483? Ranking member?
I just have an amendment to the...
Okay. I now, seeing none, I now recognize Ranking Member Takano to offer an amendment to the amendment in the nature of a substitute to H.R. 3483.
Mr. Chairman, I have an amendment to the amendment in the nature of substitute to H.R. 3483 at the desk.
The clerk shall report.
Takano amendment.
I ask unanimous consent that further reading of the amendment is dispensed with, and without objection, so ordered. The gentleman is recognized for 5 minutes to explain his amendment.
Well, thank you, Mr. Chairman. And while I appreciate the majority's intent for VA to use an IT system to detect waste, fraud, and abuse and claims submitted for payment from community care providers, I offer this amendment to correct a severe defect with the underlying text. Again, I mean, as with the previous bill, I mean, the intent is something that I'm going to align with, but in this case, this bill would allow VA to cannibalize the franchise fund to pay for this IT project. And my amendment seeks to correct this dangerous precedent the majority is attempting to set. You're going around the pay-fors that we usually use and are attempting to establish a new way to move money around. The franchise funds are a type of revolving fund that VA uses to provide services to other agencies like IT services, HR services, or business transaction support. The franchise fund operates as a self-sustaining business-like entity at the department, operating with a reserve that VA continually uses to improve the services and business lines of the fund. This bill would attempt to eat away at those reserves to pay for an IT system that performs functionality at the VA, that VA already has through the program integrity tool. Let me say that again. This bill would attempt to eat away at those reserves to pay for an IT system that performs functionality that VA already has through the program integrity tool. If the reserve is depleted, the franchise fund would not have enough to make the improvements that it needs over the years, and it may also hurt other shared services that the VA offers to other agencies. There is no requirement that agencies must use VA services, so they may just go elsewhere if the need is not met, further depleting the franchise fund and that revenue. Such depletions could cause service disruptions, and at worst, the fund could collapse, leading Congress to bail it out. Additionally, the language in this bill takes money from the franchise fund without putting the money it detects and collects from waste, fraud, and abuse claims back into the fund. The funds collected would instead go into the medical care collection fund. Essentially, this scheme raids the franchise fund and sets it up for failure. I view this as an attempt from the majority to find a new way to pay for expensive IT projects they want VA to undertake instead of advocating for more funding for the agency through the traditional appropriations process. We will oppose any efforts to use the franchise fund in this way and we hope that this does not become a regular tactic of the majority to sidestep the appropriations process. That My question to Representative Barrett is, I'm interested to hear what VA thinks, there would be in terms of savings. Shouldn't we amend the bill to put that savings back into the franchise fund instead of it going into the medical care collection fund? That's my question to my colleague. I yield for the question. I yield for an answer.
Well, Thank you to the ranking member. I would stipulate that we don't have much oversight of what the franchise fund is used for through the ordinary congressional process, and this would direct that for this specific purpose. I don't have strong opinions about where the money collected, whether it regenerates within that or it's used appropriately. It's really my intent through this bill to make sure that we are preventing and collecting on fraudulent claims that are brought forward and that we are adding to the integrity of the process. The bill was expanded in scope because there were multiple different ways in which these claims are submitted. And originally it was only going to establish that for one possible avenue. And we subsequently learned in discussions with the VA that there are multiple different ways that these claims can be submitted. And we want to make sure that they are capturing as much of the breadth of possible fraudulent claim submissions as there are. So
again, my question wasn't about oversight over this fund. It's the fact that the funds collected would go to the medical care collection fund instead of being put back into the franchise fund. You understand my concerns, our concerns, about the collapse of the franchise fund because of the whole way that it works. That we produce, it's a revolving fund that brings in revenues from the services we provide to other departments, and this is a potentially unsustainable practice. So we stand aligned on what your intent is. My hope is that we can come to maybe some agreement on how this is funded. We don't think the appropriations process should be skirted, and that we need to, I don't want to set a new precedent here that would potentially collapse this fund.
I understand.
Great. So maybe we can work together on this before it ends up in final form on the floor.
Sure. I appreciate that. Yeah.
Thank you, Mr. Chair. I agree with the purpose of the base bill as well, absolutely, but I am strongly opposed also to the use of the franchise fund to support it, and strongly support Ranking Member Takano's amendment and points. Utilizing the franchise fund in this manner would be unprecedented. The franchise fund is indeed a revolving loan fund, but the way that this has been set up, there will be no funds revolving back into it, and undermines the intention of that fund. And VA will use money from the franchise fund to procure software to detect waste, fraud, and abuse in community care billing. However, when they collect payments from the community care providers that are legitimate, that money will go to the medical care collections fund, not back into the franchise fund to repay that utilization. So strongly support the intention, believe that we need to be fully transparent about how we're funding these endeavors. And if money is going in or coming out but not going in, it's going to undermine this very quickly. It's supposed to be like a business, like any other business, input or revenue in, expenditures out. If we only have expenditures out, the solvency will be lost, and the critical function it supports will also be undermined. So thank you. I yield back.
If you need time.
10 seconds. I was just going to stipulate, I was just reminded that the VA did support that in their testimony, but I'm not opposed to working on this further to make sure that we, strike the right balance there. So, thank you.
Anyone else seeking recognition? I will recognize myself in opposition to the amendment. I find it ironic my colleagues across the aisle are constantly suspicious of VA's action when wanting to remove a provision that creates more transparency. This amendment would remove a provision that requires VA to use the franchise fund to pay for this bill. Revolving funds, like the franchise fund, operate with very little oversight, since VA has broad guidelines on how they can spend those funds, and they don't need congressional approval to do so. This year, VA will take in and spend roughly $2 billion through the franchise fund, and will have around $850 million in reserve by the end of the fiscal year. directing how department spends the money is exactly how we should be acting as the authorizing committee. That is what Representative Barrett's bill does. So I'm going to urge my colleagues to reject the amendment and take the responsibility and the authorizing seriously, show them where we need to take and use the money from. And does any other member wish to comment on the amendment? With that, seeing none. Question now occurs on the agreeing to the Takano amendment and the amendment in the nature of a substitute for H.R. 3483. All those in favor say aye. All those opposed, no? No. This is your amendment. I would have went with it, but okay. In the opinion of the chair, the noes have it. A recorded vote has been requested. Pursuant committee rules, this vote will be postponed. Are there any further amendments to the amendment to the nature of a substitute? We will now move to consider the next bill. I now call up H.R. 3494, the VA Hospital Inventory Management Systems Authorization Act. The clerk shall report the bill.
H.R. 34.
Text was circulated in advance and pursuant to committee rules without objection. The first reading is dispensed with, and the bill is now open for amendment at any point. I now recognize Representative Kiggins for the purposes of offering an amendment in the nature of a substitute.
Thank you, Mr. Chair. I'm especially grateful that my bill, the VA
Do you have an amendment at the desk?
I'm sorry. Do I have an amendment? I have an amendment.
You have an amendment at the desk. The clerk shall report the amendment.
Amendment in the nature of a substitute to H.R.
I ask unanimous consent that further reading of the amendment in the nature of a substitute be dispensed with, and I ask that it be considered as a base text for the purpose of this markup, and without objection so ordered. I now recognize Representative Kiggins for 5 minutes to speak in support of the amendment in the nature of a substitute.
Thank you, Mr. Chair. My amendment in the nature of a substitute would add an offset for the discretionary funding. This effort of the VA would help maintain and modernize the VA medical facilities, medical equipment, and continue to provide care for our veterans. I urge my colleagues to support my amendment in the nature of a substitute, and I yield back.
The gentlewoman yields back. I now recognize myself in support of the amendment. This is a common sense, straightforward bill to fix the real problem VA hospitals. For too long, outdated inventory systems have wasted taxpayer dollars and hindered providers' ability to perform their jobs efficiently and effectively. When you can't track your resources, you get waste, shortages, and veterans pay the price. That's unacceptable. This bill would force VA to modernize so that we can ensure every dollar is spent responsibly. Better oversight means better care for veterans and more accountability for taxpayers, precisely what we should expect from VA, and I urge my colleagues to support this bill to get that done. Do any other members wish to comment on the amendment in the nature of a substitute for H.R. 3494? Seeing none. Are there any amendments in the nature of a substitute to H.R. 3494? I now recognize Representative Budzinski to offer an amendment to the amendment in the nature of a substitute.
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk shall report the amendment.
Budzinski, amendment number 1.
I ask unanimous consent that further reading of the amendment be dispensed with and without objection so ordered. The gentlelady is recognized for 5 minutes to explain her amendment.
Thank you, Mr. Chairman. The VA's supply chain program is certainly enormous and one that definitely deserves a modern approach. VA has told us that they plan to restart this program for at least the 5th time. But as far as I can tell, VA has not done the work needed to make implementation efficient and effective. My amendment requires VA to conduct thorough analysis and brief the committees of jurisdiction before moving forward with modernization efforts for the supply chain program. This includes requirements to finalize a supply chain strategy, assess personnel, create a cost estimate and schedule, develop metrics to measure success, and conduct an after action on VA's previous failed attempts at supply chain modernization. Once these steps are done, VA will be able to move forward with its supply chain modernization effort. I am certainly not advocating in this situation for status quo. I want to be clear about that. And to those that might be thinking that, I pose this question back to them. What about VA's current state makes you 100% confident that they are prepared to step forward with this? If they have not looked at past failures, addressed the impacts of VA's reorganization, or developed success metrics for the modernization effort. Without an assessment of each of these, we are essentially allowing the VA to throw more money at the problem to the tune of hundreds of millions of dollars in the hope that they take the right approach. I hope I'm not alone in my concern with this logic. I urge my colleagues to vote aye on my amendment, and I yield back.
The young lady yields back, and I recognize myself in opposition to the amendment. VA has spent years trying and failing to modernize its inventory management system. This committee has spent hundreds of hours conducting oversight over these past failures, and it's time that this committee asserted the authorization, the authorized an authority to stop being a bystander to modernization project. Last year, the Supreme Court Loper decision made it clear it is Congress's, not agencies, that set the policy. This amendment would punt that responsibility to VA by requiring reporting that would delay the implementation of this bill. This amendment would also require reports on topics that have nothing to do with inventory management, like the deferred registration program and the voluntary early retirement authority. I urge my colleagues to reject the amendment and not use reporting as a tool to deflect the committee's responsibility to set policy for VA. Does any other member wish to comment on the amendment? Seeing none. The question now occurs on agreeing to the Budzinski amendment and to the amendment in the nature of a substitute. All those in favor say aye. Aye. All those opposed, no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to.
Request a roll call.
A recorded vote having been requested pursuant to committee rules, this vote will be postponed. Are there further amendments to the amendment in the nature of substitute for H.R. 3494? I now recognize Representative Ramirez to offer an amendment in the nature of substitute.
Chair, I have an amendment at the desk.
The clerk shall report the amendment.
Ramirez amendment.
Ask unanimous consent that further reading of the amendment is dispensed with without objection. So ordered. The gentlelady is recognized for 5 minutes to explain the amendment.
Chairman, thank you. This is an amendment that I have been anxious to present to you in the last hour, as you witnessed a few moments ago. But this amendment is really important. It would bar VA from contracting with any company with which a special government employee has a financial interest. Over the past several months, we have witnessed the rampant corruption of individuals that are involved with DOGE. These individuals were given access to your sensitive information, veterans, made reckless decisions across the agency, and put thousands of people at risk. This kind of rogue behavior is appalling and should concern every American taxpayer and every member of Congress. While Elon Musk is no longer a special government employee, thank God for that, he was, however, allowed to wreak havoc within the federal government for nearly 5 entire months. In a clear conflict of interest, he was allowed to become a special government employee despite building his empire on $38 billion in taxpayer funding through government contracts. However, my colleagues across the aisle are apparently willfully uninformed to conflicts of interest, possibly because they don't want to draw attention to their own, even though they claim to care about accountability and rooting out waste, fraud, and abuse in our government. The richest man on earth was able to infiltrate our government and still stands to make billions of dollars more as he and his DOGE colleagues dismantle the institutions intended to serve the American people. While some of my colleagues feel comfortable allowing this kind of outright corruption to happen at the expense of our veterans, I will not allow that to happen. I refuse to be complicit in a scheme that further enriches the 1% at the expense of veterans and taxpayers who are barely making it, while this guy's trying to figure out what island next he wants to buy. Let me say this loud and clear. To Elon Musk and to the rest of the DOGE jesters, VA is not for sale. Our veterans and their data is not for sale. It is our responsibility to make sure that Elon Musk, the special government employees he's brought in to destroy the government, and any future special government employees do not have the opportunity to turn the VA into another business they ultimately will run into the ground. I urge all my colleagues to support my amendment, and I passionately yield back.
The gentlelady yields back, and I recognize myself in opposition to the amendment. Let me be clear, the amendment is unnecessary and misguided. There are federal ethics laws, regulations that prohibit government employees, including special government employees, from using their government position for financial gain. The idea that VA needs special rules is based on nothing and is distraction from VA's mission and the work we do here in Congress. We should focus on the job at hand, delivering for veterans, not chasing false narratives or creating problems that don't exist. I urge my colleagues to oppose the amendment. And does any other member wish to comment on the Ramirez amendment? Somebody did, I guess. Ranking member.
Mr. Chairman, the assertion that the concerns that have been raised by Ms. Ramirez and her amendment, that they emanate from false narratives, use of the word false narratives, this is patently untrue. We have witnessed unprecedented actions by a special government employee in the name of Elon Musk, and I think clarifying in statute what the ethical obligations are of contractors is very important. Anyway, that is, I support Ms. Ramirez's amendment, and I yield back.
Anyone else seeking recognition? Seeing none. The question now occurs on agreeing to Ramirez's amendment to the amendment in the nature of a substitute. All those in favor say aye.
Aye.
Those opposed say no. No. In the opinion of the chair, the noes have it. The amendment is not agreed to.
I'd like a
recorded vote has been requested, and pursuant to committee rules, the vote will be postponed. Without objection, the motion to never mind, we jumped one. Okay, there we are. Are there any further amendments to the amendment in the nature of substitute to H.R. 3494? Seeing none and hearing none, we will go in order to the next bill. All right. H.R. 3455. I now call up H.R. 3455, the Veterans Affairs Distributed Ledger Innovation Act. The clerk shall report.
H.R. 3455, to direct the Secretary...
Bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with, and the bill is open to amendments at any point. I now recognize myself for 5 minutes to speak in favor of this legislation. I'm glad to see my colleague, Representative Mace, introduce the VA Distributed Ledger Innovation Act. I don't know why that's hard to say. I admire Representative Mace's commitment to spearheading this in innovation legislation and move VA from the Stone Age into the New Age. This legislation would direct VA to study how blockchain technology can modernize and improve the veterans' benefits claims process. VA must continue to be an innovative organization to deliver quality, advanced health care and benefits to our veterans. This bill would ensure VA stays on track. It has my full support, and I yield back. Does any other member wish to comment on the bill? Representative Mace, you're not recognized.
Thank you, Mr. Chairman. The VA runs on a patchwork of decades-old legacy systems which are slow, inefficient, and prone to security vulnerabilities. These systems often stand in the way of veterans receiving their benefits in a timely manner, leaving veterans to navigate a maze of outdated portals and paperwork. These outdated legacy systems also serve as a target for waste, fraud, and abuse, siphoning crucial resources away from our veterans who earned them. Our veterans and the American taxpayer deserve better. Distributed ledger technology such as blockchain has the potential to transform how veterans access their benefits by providing greater efficiency, greater security, and greater transparency. My bill, H.R. 3455, the Veterans Affairs Distributed Ledger Innovation Act, is an important step to bringing the VA into the 21st century. This bill would direct the Secretary of Veterans Affairs to conduct a comprehensive study on how blockchain technology can be used to improve the clarity, traceability, and reliability of veterans' benefits claims, reduce the risk of fraudulent and inaccurate claims, and improve the accountability and the handling of claims and identify irregularities in benefits delivery. To keep the promises this country has made to veterans and to prevent fraudsters from diverting crucial resources away from our veterans, our technology must adapt with the times and come into the 21st century. Blockchain technology creates an unchangeable, auditable trail of interactions. It's time-stamped and tamper-proof, decentralized and secure, and authenticity can be verified instantaneously. In the financial services industry, we have seen blockchain-based solutions reduce processing times from days down to seconds. Imagine the applications within the VA on modernizing claims processing. If the VA adopts this technology, the days of waiting weeks for verification letters could be over. We owe it to our veterans to ensure outdated technology doesn't stand between them and the benefits that they've earned. And we owe it to the American taxpayer to ensure benefits are not a target for waste, fraud, or abuse. So I ask unanimous consent, Mr. Chairman, to enter into the record a letter of support of my bill, the Veterans Affairs Distributed Ledger Innovation Act, from the Digital Chamber into the record.
Without objection.
This bill is not a mandate to adopt blockchain overnight. It is a directive to study the technology, assess its value, and report back to Congress on findings and next steps. This is how we modernize thoughtfully. New technologies can help us build systems which are efficient, secure, and transparent. This bill is a step towards bringing the VA into the 21st century in a way which is deliberate and veteran-focused. So I urge all members on both sides of the aisle to support this common-sense modernization effort to help ensure veterans have timely access to the benefits they were promised, and I yield back.
Does any other member wish to comment on the bill? I now recognize Ranking Member Takano to offer an amendment to H.R. 3455.
I have an amendment at the desk to H.R. 3455 at the desk.
The clerk will report the amendment.
Amendment to H.R.
Ask unanimous consent that further reading of the amendment is dispensed with without objection. So ordered. The gentleman is recognized for 5 minutes to explain his amendment.
Thank you, Chairman Boss. It's similar to Representative Budzinski's remarks on H.R. 3494 on supply chain management, supply chain modernization effort. I worry that the passage of this bill may accelerate VA's involvement in an unvetted technology. My amendment would make meaningful changes to ensure that this study does not just become a check-in-the-box exercise, and would ensure that VA is, in fact, ready to take on this technology if analysis supports that approach. While the study would assess whether blockchain technology might improve operations, my amendment would ensure it also addressed how it may also create security vulnerabilities, data privacy concerns, or undue pressure on an already constrained OIT workforce. Further, VA should also take the time to consider if other potential solutions, like databases or cloud solutions, may be a better fit for VA and its budget. I'm not offering this amendment here today to say that blockchain definitively has no place at VA. I cannot tell the future on that. I'm simply here noting that before it rolls out such technology, it should have internal regulations that provide guidelines for its use, a governance structure to ensure that the right stakeholders are involved with its implementation and organization, and an overall strategy that takes into consideration staffing across the department, particularly within VA's modernization workforce, as well as the myriad other substantial projects that VA is undertaking, such as the electronic health record, FMBT, and supply chain, to name a few. VA told us that it was not ready to implement distributed ledger technology in the Oversight and Investigation Subcommittee legislative hearing on this bill, where it did not offer a position on the bill. So VA did not offer a position on this bill. VA also has not provided technical assistance for this piece of legislation. So as of today, we really don't know where VA stands in terms of assessing blockchain. Ultimately, many of the bills on today's agenda, H.R. 3455 included, seem to be pushing forward modernization efforts without performing the legwork to ensure that VA's workforce and systems are able to handle such efforts and that the necessary support structures are in place. I urge my colleagues to join me in helping VA modernize itself, not throw money out the door at fixes that are half-baked and may impair VA's ability to deliver on its mission. I urge my colleagues to support additional accountability measures in my amendment, and I ask them to support it. Thank you, and I yield back, Mr. Chairman.
Gentleman yields back. I recognize myself in opposition to the amendment. In order to modernize VA, we need to understand new technology that can make VA a more secure and efficient organization. The underlying bill does not require VA to use distributed ledger technology. It simply directs VA to study what the benefits and risks are. Yet this amendment puts roadblocks on the implementing this technology before it's even been studied. The amendment would also expand the study to look at alternative solutions like database, cloud solutions, and other subjects beyond the purpose of the study, whether the technology could be useful. I urge my colleagues to reject the amendment, to keep the bill focused on the intended purpose. And does any other member wish to comment on the amendment?
Yes, Mr. Chairman.
The gentlelady is recognized.
Thank you, and with all due respect to the ranking member, he laid out the reasons why we should support this amendment. This is why the VA is stuck. This is why China is eating our lunch, is because we refuse to modernize, and every time we have a chance to modernize technology and systems to prevent waste, fraud, and abuse, et cetera, Congress has a great ability to stifle that innovation, to slow it down, and that's why we have legacy systems built on COBOL from 30, 40, 50 years ago that we just can't move forward. We have a VA website that veterans can't navigate, and so this bill does not roll out any technology. It is simply a comprehensive study, and will determine, if and how and where, if at all, blockchain technology can be used at the VA to help our veterans, first and foremost. And so I would ask my colleagues on both sides of the aisle to support this. Thank you, Mr. Chairman. I yield back.
Anyone else seeking recognition on the Takano amendment? Seeing none, the question now occurs on agreeing to the Takano amendment to H.R. 3455. All those in favor say aye.
Aye.
Those opposed, no. No. In the opinion of the chair, the noes have it. The noes do have it. And without objection, the motion to reconsider is laid on the table. Any further amendments to H.R. 3455? I now recognize General Berkman for a motion.
Mr. Chairman, I move that the committee favorably report H.R. 3455 to the full House.
The question is, on favorably reporting H.R. 3455, all those in favor say aye. Aye. Those opposed, no.
No.
In the opinion of the chair, the ayes have it. The motion to reconsider is laid on the table. The motion is agreed to, and H.R. 3455 is reported favorably to the House.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority, supplemental, additional, or dissenting views on H.R. 3455 as amended.
Without objection. I now call up H.R. 2334 to preempt any squatters' rights established by the state law regarding real property owned by a member of the uniformed services. The clerk shall report.
H.R. 2334.
The text was circulated in advance pursuant to committee rules, and without objection, the first reading is dispensed with, and the bill is now open for amendments at any point. I now recognize myself for the purposes of offering an amendment in the nature of a substitute. The clerk shall report the amendment in the nature of a substitute.
Boston Amendment.
I ask unanimous consent that further reading of the amendment in the nature of a substitute is dispensed with, and I ask it be considered base text for purposes of this markup. Without objection, so ordered. I now recognize myself for 5 minutes to speak in support of the amendment in the nature of substitute. The ANS would add a short title to the bill and revise the language to clarify congressional intent. Under current law, the Service Members Civil Relief Act does not protect a service member who returns home from military orders and finds individuals residing in their home illegally from assistance due to the state squatter protection laws. To remove these individuals, service members must fight their state government and typically pay costly fees to get trespassers out of their home, out of the homes they own. This bill would close this loophole by ensuring that the state squatter laws do not allow squatters to occupy service members' homes while they are away on active duty. Additionally, it would ensure our nation's service members have the right to quickly, easily effect trespassers instead of going through an expensive, time-consuming process. I want to thank my friend and colleague, Representative Mast, for bringing this very important issue to the committee on behalf of our service members. Do any members wish to comment on the amendment in the nature of a substitute for H.R. 2334? Seeing none. Are there any amendments to the amendment in the nature of a substitute for H.R. 2334?
Mr. Chairman,
I recognize the ranking member Takano for the purpose of offering a substitute amendment to the amendment in the nature of a substitute.
Mr. Chairman, I have a substitute amendment to the amendment in the nature of substitute to H.R. 2334 at the desk.
The clerk shall report the amendment.
Substitute for
I ask unanimous consent that further reading of the amendment be dispensed with without objection, so ordered. I now recognize Ranking Member Takano for 5 minutes to speak in support of his amendment.
Thank you, Mr. Chairman. Look, no service member who deploys should have to worry about squatters adversely possessing or claiming ownership of their property while they're away serving our country. On that point, we are agreed. Adverse possession, really, but I just want to caution us. Adverse possession is a nuanced legal issue governed by state and local real property law, which requires us to carefully amend the Service Members Civil Relief Act, or SCRA, to preempt those laws and address this issue for deployed service members. While specific elements that must be proven for an individual to adversely possess a property vary by state, all locales share the requirement that the individual must inhabit the property for a specified period of time, which varies between 4 and 20 years. Now, my amendment to the amendment in the nature of a substitute fixes a fundamental defect to the underlying text and would apply the legal concept of tolling to adverse possession cases for service members. In essence, tolling stops the clock and is used when a party is unable to act due to circumstances beyond their control. So my amendment, quote unquote, stops the clock during service members' entire period of service for individuals who may try to claim ownership of the service member's property. So let me give you an example. It's kind of complicated to hear how that works. Let's say that we're in Kentucky. My friend's Kentucky, yes. We're going to use Kentucky as an example today. Let's say we're in Kentucky, maybe Lexington, where adverse possession requires 15 years of continuous possession. Let's say that a service member stationed at Fort Knox receives 5 years, and during those 5 years leaves their primary residence in Louisville. We're talking about Louisville, not Lexington. Leaves their primary residence in Louisville vacant while they live on base. All right, so it's been vacant. If an individual moves into the service member's property and tries to claim ownership, my amendment would stop the clock, and those 5 years of service would not count toward the 15 years of possession that individual would need to claim ownership of the property under Kentucky law. The 15-year clock would not begin until the service member's period of service is over. Courts in multiple states have interpreted SCRA's existing tolling provision to, quote unquote, stop the clock for adverse possession during service members' periods of service. but my amendment would eliminate any potential ambiguity and clarify that SCRA does just that. I had major concerns that the amendment in the nature of a substitute would not withstand the Loper-Bright scrutiny because it was so vague. My amendment provides legal clarity to that vagueness. However, I remain concerned that our efforts on this legislation will not provide the urgent relief that service members desire and deserve when they return home from deployments to find trespassers or squatters on their property. The nerve, think about that. Service members will still have to engage in local law enforcement to bring trespassing charges, to remove squatters from their property, or start eviction proceedings if they have a holdover tenant who has overstayed their lease. My amendment adds a requirement that VA use its existing SCRA websites and resources to educate veterans on how to secure their property while deployed, how to be a landlord, and how to protect their rights. I look forward to continue to working with the majority to strengthen this language before it heads to the floor for consideration. I urge my colleagues to therefore vote yes on my substitute amendment to the amendment in nature of substitute. And with that, I yield back.
The gentleman yields back, and I recognize myself in support of the amendment. The ranking member's amendment would modify the language in current statute instead of making a new section. The amendment would also require VA to provide information to service members about their rights under this section. While I applaud the ranking member for promoting transparency, I'm concerned about why he chose VA instead of Department of Justice. Currently, the DOJ is the only enforcer of FCRA violations. Additionally, the service members goes to the DOJ, not to VA, if he or she believes their rights have been violated. During the 117th Congress, the ranking member and I worked together to provide several FCRA protections to service members. It was the DOJ, not the VA, who provided information to the service members and the states. What the bill does now is like having GI Bill information being sent out by the Department of Labor. It does not make sense, and I understand the ranking member staff has already made a commitment to working with the majority before this bill goes to the floor to make sure the agencies, who is the subject of this matter, are the experts, is the one sending the information to the service member. To not let perfect be the enemy of the good with the ranking member's language, I will support it with the intent that more work is still to be needed in this language, and I urge my colleagues to support the amendment as well in the underlying bill, and I yield back. And would any other member wish to comment on the Takano amendment? Hearing none. The question now occurs on agreeing to the Takano substitute amendment and the amendment in the nature of a substitute to H.R. 2334. All those in favor say aye. Aye.
Aye.
In the opinion of the chair, any opposed, say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to. The motion to reconsider is laid on the table. The question now occurs on agreeing to the amendment in the nature of substitute on H.R. 2334 as amended. All those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, the ayes have it, and the amendment in the nature of substitute as amended is agreed to. The motion to reconsider is laid on the table. I now recognize Representative Takano for a motion.
Mr. Chairman, I move that H.R. 2334 as amended be reported favorably to the House.
The question is favorably reporting the H.R. 2334 as amended to the House. All those in favor say aye. Aye. The opposed say no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 2334 as amended is reported favorably to the House. The motion to reconsider is laid on the table.
Mr. Chairman, pursuant to H.R. Rule 11, Clause 2, I give notice of intent to file minority, supplemental, additional, or dissenting views on H.R. 2334 as amended. I'm very pleased that we came to an agreement that we both dislike squatters and trespassers.
There you go. Without objection, by the way. I now call up H.R. 3863, the VA Mental Health Outreach and Engagement Act. The clerk shall report the bill.
H.R.
Bill was
38.
circulated in advance and pursuant to committee rules. Without objection, the first reading is dispensed with, and the bill is open for amendment at any point. I now recognize Representative Bazinski for the purpose of offering an amendment in the nature of a substitute.
Thank you. Mr. Chairman, I have an amendment at the desk.
Clerk shall report the amendment in the nature of a substitute.
Bazinski
I ask
amendment.
unanimous consent that further reading of the amendment in the nature of a substitute be dispensed with, and I asked that it be considered base text for the purpose of this markup, and without objection, so order. I now recognize Representative Bazinski for her 5 minutes to speak in support of the amendment in the nature of a substitute.
Thank you, Mr. Chairman. My amendment clarifies the types and numbers of contact attempts VA must do, and it requires VA to report on the most effective contact types and contract rates. I want to thank Congressman Chuck Edwards for co-leading on this bipartisan bill. I'm also grateful to have the support of the Disabled American Veterans, the American Psychiatric Association, and the USAA, which have all endorsed this bill. As a member of this committee, I've heard from veterans unaware of where to turn for support and care for the invisible wounds of war. My bill, H.R. 3863, the VA Mental Health Outreach and Engagement Act, would expand VA's outreach to veterans about mental health services. We must support our veterans and provide them with the knowledge and resources to prosper following their service to our nation. My bill would ensure we are proactively reaching out to veterans with mental health-related service-connected disabilities and connecting them with the care that they need. Navigating the VA should never be a burden. And this bipartisan legislation will help make it easier for veterans to get the mental health care that they've earned. I urge my colleagues to support this clarifying amendment and the bill as amended. Thank you, and I yield back.
The gentlelady yields back. I now recognize myself in support of the amendment. Representative Bazinski bill would build on our work by requiring VA to offer a mental health consultation to veterans who receive disability compensation for a mental health diagnosis. For a veteran dealing with mental health issues, this bill would unify the two sides of VA, the benefit side and the health side. It makes sense for VA to check in on these veterans. I thank Representative Brzezinski for her proposal. And do any other members wish to comment on the amendment in the nature of substitute to H.R. 3863? Seeing none. Are there any amendments to the amendment in the nature of substitute for H.R. 3863?
Mr. Chairman, I have an amendment at the desk.
I now recognize Representative Bazinski to offer the amendment, and
This
clerk will
amendment-
report.
Bazinski amendment number 1. Amendment to the amendment.
I ask unanimous consent that further reading of the amendment is dispensed with, and without objection, so ordered. The gentlelady is recognized for 5 minutes to explain her amendment.
This amendment adds a pay-for this crucial legislation using the home loan fees offset. I urge my colleagues to support the amendment. Thank you, and I yield back.
I recognize the lady yields back, and I recognize myself to speak on the amendment. I would like to thank my colleague from Illinois for this amendment, which fully offsets her legislation. I'm confident that my staff will work closely with yours to identify the ways to reduce the preliminary score of this legislation. Does any other member seek to make comment on the amendment? Mr. Sell.
Mr. Chairman, just a clarifying question. This is mandatory spending. I just want to make sure that the offset offsets mandatory spending, just to clarify. Because mandatory spending is where our deficit and debt are growing the most.
Let me get an answer for you exactly. Yes, it is. It's mandatory.
Thank you. No, the offset's mandatory.
The offset's mandatory.
Okay, thank you.
Other questions? Seeing none, the question now occurs on agreeing to the Bazinski amendment in the nature of a substitute for H.R. 3863. All those in favor say aye. Aye. Opposed say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to. Without objection, the motion to reconsider is laid on the table. Are there any further amendments to the amendment in the nature of a substitute for H.R. 3863? Hearing none. The question now occurs on agreeing to the amendment in the nature of a substitute for H.R. 3863 as amended. All those in favor say aye. Aye. All those opposed, say no. In the opinion of the chair, the ayes have it. The amendment is, in the nature of a substitute, is agreed to. The motion to reconsider is laid on the table. I now recognize Ranking Member Takano for a motion.
Mr. Chairman, I move that H.R. 3863 as amended be favorably reported to the House.
The question is on favorably reporting H.R. 3863 as amended to the full House. All those in favor say aye. Aye. All those opposed, no. The ayes have it. The motion is agreed to, and H.R. 3863 as amended is reported favorably to the House. The motion to reconsider is laid on the table. Ranking Member.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority, supplemental, additional, or dissenting views on H.R. 3400 as amended. And congratulations to my colleague, Ms. Bazinski.
Without objection. I now ask unanimous consent to consider in block the following bills. H.R. 2137, H.R. 3123, H.R. 3834, H.R. 2701, H.R. 2721, H.R. 3767, H.R. 2791, H.R. 3481, H.R. 3579, H.R. 2954, H.R. 3812, and H.R. 2034, and H.R. 3854. Is there any objection to considering any of these bills in block? Hearing no objection, so ordered. The clerk shall report the bills.
En bloc.
The bills were circulated in advance, and pursuant to committee rules, I ask that the reading of the bills be dispensed with, and without objection, so ordered. Each of these bills has an amendment in the nature of a substitute, which I ask unanimous consent to consider as base text. Without objection, so ordered. Does any member seek to speak on any of the bills included in the en bloc? Representative Kennedy, we'll start there.
Thank you, Mr. Chairman. I do wish to speak on the en bloc.
The gentleman's recognized.
Again, thank you, Mr. Chairman, Ranking Member Takano, members of the committee. We are grateful for the opportunity not only to speak in support of this en bloc, which contains my bill honoring our HEROES Act, but all of our collective efforts in a bipartisan fashion to make this a reality. The Honoring Our Heroes Act was born from conversations with military families in Western New York, families who've discovered after their loved one's passing that they did not qualify for a VA-issued headstone simply because of a date written into federal code. Right now, the VA denies this honor to veterans who died before November 1st, 1990, an arbitrary cutoff put in place not out of fairness, but simply to save money. And that is wrong. As members of this esteemed committee, we all know that service doesn't expire. And the families left behind aren't looking for favors. They're simply asking that our government recognize their loved ones with the same dignity that others have been afforded and that they have earned and deserve. These men and women answered the call to serve, and the least that we can do is recognize that service. That's why I introduced the Honoring Our Heroes Act, to restore fairness, to correct this injustice, and to ensure that no veteran's memory is forgotten because of when they died. With your partnership, we're taking a meaningful step toward dignity, respect, and lasting recognition for all who have worn the uniform. And after months of hard work, this bill will finally pass this committee and hopefully go to the House floor. I again want to thank Chairman Bost, Ranking Member Takano, and their teams for working with me and my office to get this bill closer to the finish line. We don't see many acts of bipartisanship these days, but it's comforting to know that this committee can still come together to set things right for our veterans and right the wrongs of the past. Passage of this bill will mean everything to the families in each of our districts who've waited years to recognize their loved ones with the honor that they have rightfully earned. I respectfully urge the committee to support en bloc number 1. Let's help ensure that no veteran's legacy is forgotten. I yield back.
Gentleman yields back. Representative Barrett, you're recognized for 5 minutes.
Thank you, Mr. Chairman. And just wanted to briefly cover the amendment in the nature of a substitute that would make technical changes to my bill, H.R. 3481, the Bipartisan Delivering Digitally for Our Veterans Act. I want to start by thanking the Derricks, Derek Tran from California and Derek Van Orden from Wisconsin, for their support of this important bill. The amendment in the nature of a substitute would include my friend and colleague Representative Van Orden's bill, the Streamlining Solid Start Communications Act. Additionally, this amendment will provide an offset that it is cost neutral and fiscally responsible. Modernizing the VA's antiquated systems is essential to ensuring that today's veterans can receive the care and services that they need and have earned through their service. The amendment would include the changes to the Solid Start program, expanding VA's outreach methods to veterans by allowing transitioning service members to get updates through digital messages as an alternative to phone calls. The amendment will also allow veterans to opt in to receive digital messaging instead of traditional mail, making it easier for them to receive GI Bill updates. I personally went to college using the GI Bill at a time when we did not have text messaging and other digital means of communication that were available today. This change will provide veterans with better access to information and benefits for which they are eligible and entitled to. It will make things easier for them along the way. It's time to modernize the VA's electronic messaging system, and it's time to finally bring the VA into the 21st century. I urge my colleagues to support H.R. 3481 as amended, and I yield back. Thank you.
Gentleman yields back. I now recognize the representative from Illinois, Representative Baczynski, for 5 minutes.
Thank you, Mr. Chairman. I'd like to speak in favor of two bills in this en bloc. I want to thank my colleague on this committee, Congressman Hamadeh, for his collaboration on two bipartisan bills, H.R. 2034 and H.R. 3767. My bill, H.R. 2034, the Edith North Rogers STEM Scholarship Opportunity Act, would help ease the transition for our student vets seeking a STEM education by modifying eligibility requirements for the Edith North Rogers STEM Scholarship Program. This scholarship has proven crucial to getting more veterans involved in STEM fields, but feedback from veterans and a 2022 GAO report has shown that current eligibility requirements are barriers for many of our student veterans. My bill would address these barriers by lowering the minimum number of credit hours required and allowing student veterans to apply for the scholarship before their post-9/11 GI Bill benefits run out, which would allow for a smooth transition of funding for their education. I also want to speak in support of H.R. 3767, the Health Professional Scholarship Program Improvements Act. VA's Health Professional Scholarship Program supports students pursuing healthcare careers while connecting VA with talented staff. But when program participants graduate, they are often met with delays in receiving a contract. Amid VHA staffing shortages, we need solutions to address this inefficiency. This legislation would streamline the path for HPSP participants to start working full-time, making it easier for veterans to get the care that they need. I urge my colleagues to support these two bills as amended and vote aye to en bloc number 1. Thank you, and I yield back.
The General Lady yields back. Does any other body seek? Dr. Morrison, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I wish to speak to the en bloc.
You're recognized for 5 minutes.
Thank you, Mr. Chairman. I rise in support of the ANS to H.R. 3854, the Modernizing All Veterans and Survivors Claims Processing Act. This legislation includes the Justice for America's Veterans and Survivors Act, which I am proudly co-leading with my colleague from North Carolina, Mr. Edwards. Our bipartisan legislation asks VA to report to Congress on the prevailing causes of death among veterans. Knowing that thorough and accurate data is essential to informing the decisions we make as legislators, so it's critical that we have the best data available to monitor and respond to the most significant challenges facing our veterans after their service. Whether it be veteran suicide, toxic exposure, or other harmful illness, this information will help both VA and Congress develop policy responses and necessary interventions to the most serious conditions facing our veterans today. The data reported under this legislation also includes information on veterans with service-connected disability, which will help support surviving family members and ensure they gain timely access to the services and benefits they are entitled to. I want to thank the chairman and the ranking member for their support, along with Representative Edwards for his partnership on this legislation. I urge my colleagues to support the en bloc, and I yield back.
The gentlewoman yields back. Does anyone else seek recognition? Seeing none. The question now occurs on agreeing to each of the amendments in the nature of a substitute included in the en bloc. All those in favor, vote, say aye.
Aye.
Aye. All those opposed, no. In the opinion of the chair, the ayes have it, and the amendments in the nature of a substitute are agreed to. Without objection, the motion to reconsider is laid on the table. I now recognize Ranking Member Takano for a motion.
Mr. Chairman, I move that the bills considered en bloc with amendments, H.R. 2034, H.R. 2137, H.R. 2701, H.R. 2721, H.R. 2791, H.R. 2954, H.R. 3123, H.R. 3481, H.R. 3579, H.R. 3767, H.R. 3812, H.R. 3834, and H.R. 3854 be reported favorably to the House.
There is a motion to favorably report the bills as amended, including the en bloc, to the House of Representatives. All those in favor say aye. Aye. Opposed, no. In the opinion of the chair, the ayes have it, and the bill as amended are favorably reported to the House.
Mr. Chairman, pursuant to House Rule Clause 2, I give notice of intent to file minority supplemental, additional, or dissenting views on the amended bills H.R. 2034, H.R. 2137, H.R. 2701, H.R. 2721, H.R. 2791, H.R. 2954, H.R. 3123, H.R. 3481, H.R. 3579, H.R. 3767, H.R. 3812, H.R. 3834, and H.R. 3854 on all of those.
Yes. Without objection. There we go. I now ask unanimous consent to consider en bloc the following bills that do not have amendments: H.R. 659 and H.R. 4446. Is there any objection to either of these bills being included in the en bloc? Hearing no objection, so ordered. The clerk shall report the bills.
En bloc number
The bills were circulated in advance pursuant to committee rules, and I ask that the reading of the bills be dispensed with, and without objection, so ordered. Does any member wish to speak on any of the bills included in the en bloc? Seeing none. I now recognize Ranking Member Takano for a motion.
Mr. Chairman, I move that the bills considered en bloc, H.R. 659 and H.R. 4446, be reported favorably to the House.
There is a motion to favorably report the bill included in en bloc to the House of Representatives. All those in favor say aye.
Aye.
Aye. Opposed, no. In the opinion of the chair, the ayes have it, and the bill is favorably reported to the House.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority supplemental, additional, or dissenting views on H.R. 659 and H.R. 4446.
Without objection. I now ask unanimous consent to consider an en bloc the PACT Act and fiscal year 2025 lease resolutions. Hearing no objection, so ordered. The clerk shall report the lease resolutions.
En bloc number
The
3.
resolutions were circulated in advance and pursuant to committee rules. I ask that the reading of the resolutions be dispensed with, and without objection, so ordered. Does any member wish to speak on the resolutions included in the en bloc?
Mr. Chairman.
Ranking Member.
Mr. Chairman, thank you. I'm glad that we're moving forward today to approve VA's fiscal year 2025 and PACT Act major medical leases authorizations. These leases will provide crucial access to VA healthcare services for veterans across the country. Thanks to the PACT Act, Congress streamlined the lease approval process, turning what used to be a frustrating and time-consuming bottleneck into a more efficient exercise. This means that approving the leases and making sure veterans get access to new clinics in their communities is much, much quicker than it was previously. These leases reflect collaboration across parties, chambers, and committees, exactly the kind of bicameral, bipartisan cooperation that we need more of. But I would be remiss if I didn't raise a troubling exception that risks undermining that spirit. Those with sharp eyes will notice that these lease resolutions are all identical to those that have passed the Senate Veterans Affairs Committee, and Environment and Public Works Committee, and with one very notable exception. The one lease in this package for a new community-based outpatient clinic in Plano, Texas, was altered at the last minute. This unilateral change was not communicated in advance to any of the other committees involved in this decision before the House Transportation and Infrastructure Committee approved it on June 11th. It was not discussed among House and Senate Veterans Affairs Committee staff as part of a collaborative attempt to find a solution. It was not immediately clear whether the significant consequences of this change had been fully understood before moving forward. I understand that members of Congress may want to exert influence over where facilities land in their district, but there's a responsible way to do that, through coordination and intercommittee cooperation, not by unilateral decisions from one corner that will derail and delay progress for veterans. This isn't just a matter of process. This is about consequences and delays for veterans. Unfortunately, making this change in the way my majority colleagues went about it will significantly delay progress on procurement and access to a leased facility for veterans in Plano. I understand arguments that it is important to make sure facilities are constructed in the best location from the beginning. However, there is a way to accomplish that, and that way is not to wait until the last minute to engage and be the last corner to take action and create a process whereby member offices can earmark a location for facilities in their district as long as they are okay with disrupting the procurement process and delaying access to care for veterans. These are rare opportunities for bicameral bipartisanship, let me just say it again. These are very rare opportunities for bicameral, bipartisan cooperative action in our current environment. Approving these crucial leases should have been one such opportunity. But when one corner decides that they know best and chooses to move forward without communicating and without cooperating, that opportunity is wasted. Now, I want to be clear. I support approving these leases today. We cannot allow one bad process to delay dozens of urgently needed facilities. But unfortunately, veterans in Plano who would have had access to a new VA clinic next year will now likely face a delay of at least 10 months, maybe more, as VA has to start over its procurement process due to this change. I'm also concerned that despite being aware of this delay, our Republican colleagues have chosen to continue on this path, and I sincerely hope this does not become precedent. Veterans deserve better. Again, despite my concerns, I will support these lease resolutions today to ensure that those without changes are approved as soon as possible, and I yield back.
I appreciate the ranking member's concern, but VA resources must follow the veteran, not the other way around. The delineated area from the lease for Plano, Texas meets the veterans where they are. Yes, we are specifying where VA should build a new outpatient clinic. That is Congress's job. We are making sure money goes to veterans, not a party-used or empty building. So with that, I now recognize the ranking member for a motion.
Mr. Chairman, I move that the resolutions considered en bloc, the fiscal year 2025 and PACT Act VA major medical leases authorizations, be adopted by the committee.
There is a motion to approve the resolution included in the en bloc. All those in favor say aye. Aye. All those opposed, no. In the opinion of the chair, the ayes have it, and the lease resolutions are approved. Thank you, member.
Pursuant to clause 11, there's no committee.
No committees, okay. The members should be advised we're going to go into a brief recess to set up the recording vote systems, and that all members are being advised to get back here to committee for the votes, and we'll have to also get some out of other committees where other committees are voting, where they're at. So
I've got a 2:30 vote on workforce.
Okay.
That's what I'm hearing.
That's, yeah.
We'll have to stagger it.
The bright side is these votes move.
And the ones over there will too.
I hope.
maybe longer.
We're trying to get everybody here is all. Okay, if everybody will please get in their seats. I think we've got, that way we know when everybody's here. So be advised, we're going to start out with a test. How many are? As we vote on the actual bill, The committee for postpone further proceedings on the amendment number 4 to amendment in the nature of a substitute offered by Representative Brownlee to H.R. 740. Got it? Okay. The question occurs on agreeing to the amendment. Members will record their vote by using their electronic voting system. The chairman intends to vote no. Yes. That's not fair. The chair intends to vote no.
Ranking member intends to vote yes.
Voting's open. The clerk, have all members voted? Does any member wish to change their vote? The clerk will report. The clerk will close the vote and announce the results.
Mr. Chairman, the vote is 11 yeas and 12 noes.
There are 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. Committees postpone further proceedings on amendment number 5 to the amendment in the nature of a substitute offered by Representative Conaway to Dr. Conaway to H.R. 740. The question occurs on agreeing to the amendment. Members will record their vote by using the electronic voting system. The chairman intends to vote no.
Ranking member intends to vote yes.
Clerk will now open the vote on Conaway Amendment number 5 to the amendment in the nature of a substitute for H.R. 740. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the total.
Mr. Chairman, there are 11 yeas and 12 noes.
There is 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on amendment number 6 to the amendment in the nature of a substitute offered by Representative Dexter to H.R. 740. The question occurs on agreeing to the amendment. Members will record their vote using the electronic voting system. The chairman intends to vote no.
Ranking member votes no. Votes yes.
The clerk will now open the vote and the Dexter amendment in the nature of substitute on H.R. 40. Have all members voted? There we go. Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 11 yeas and 12 noes.
There's 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on the amendment to number 10 to the amendment in the nature of a substitute offered by Representative Shifless McCormick on H.R. 740. The question now occurs on agreeing to the amendment. Members will record their vote using the electronic voting system. The chairman intends to vote nay. The
Ranking member intends to vote yes.
The clerk will now open the vote on the Shiflett-McCormick amendment and in the nature of substitute to H.R. 740. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk can close the vote and announce the totals.
Mr. Chairman, there are 11 yeas and 12 noes.
There are 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The committee postponed future proceedings by amendment number 8 to the amendment in the nature of a substitute offered by Representative Takano on H.R. 740. The question occurs on agreeing to the amendment. Members will record their vote using the electronic voting system. The chairman intends to vote no.
Ranking member intends to vote yes.
The clerk will now open the vote on the Takano amendment number 8 to the amendment in the nature of a substitute on H.R. 740. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk can close the vote and announce the total.
Mr. Chairman, there are 11 yeas and 12 noes.
There are 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on amendment number 1 to the amendment in the nature of a substitute offered by Representative Dr. Conaway to H.R. 740. The question occurs on agreeing to the amendment. Members will record their votes by using electronic voting system. The chairman intends to vote no.
Ranking member intends to vote yes.
The clerk will now open the vote, and on the Conaway amendment number 1 to the amendment in the nature of a substitute on H.R. 740. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the total.
Mr. Chairman, there are 11 yeas and 12 noes.
There are 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on the amendment to the amendment in the nature of a substitute offered by Representative Morrison to H.R. 740. The question occurs on agreeing to the amendment. Members will record their vote by using electronic voting system. The chair intends to vote no.
Ranking member intends to vote yes.
The clerk will now open the vote on the Morris amendment and to the amendment in the nature of substitute for H.R. 740. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 11 yeas and 12 noes.
There are 11 yeas and 12 noes. The amendment is not agreed to. Without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on amendment number 9 to the amendment in the nature of a substitute by Representative Dr. Conaway to H.R. 740. The question occurs on agreeing to the amendment. Members will record their vote using electronic voting system. The chairman intends to vote no.
Ranking member intends to vote yes.
The clerk now open the vote on the Conaway amendment number 9 and to the amendment in the nature of substitute for H.R. 740. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 11 yeas and 12 noes.
There are 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The question now occurs on agreeing to the amendment in the nature of a substitute on H.R. 740 as amended. All those in favor say aye. Aye. All opposed say no.
No.
In the opinion of the chair, the ayes have it, and the amendment in the nature of substitute is agreed to.
Mr. Chairman, I request a recorded vote.
A recorded vote having been requested, the question occurs on agreeing to the amendment in the nature of a substitute on H.R. 740 as amended. Members will record their vote using electronic voting system. The chairman intends to vote aye.
Ranking member intends to vote no. No.
The clerk will now open the vote and amendment on the nature of a substitute on H.R. 740 as amended. Have all members voted? Here we go. Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 12 yeas and 11 noes.
12 yeas and 11 noes. The amendment in the nature of a substitute to H.R. 740 as amended is agreed to. Without objection, the motion to reconsider is laid on the table. I now recognize General Berkman for a motion.
Mr. Chairman, I move that the committee favorably report H.R. 740 as amended to the full House.
All those in favor say aye. Aye. All those opposed, no.
No.
In the opinion of the chair, the ayes have it. The motion is agreed to, and
I request a recorded vote.
a recorded vote has been requested. The question occurs on the motion favorably reported to H.R. 740 as amended. Members will record their vote by using the electronic system. The chairman intends to vote aye.
Ranking member intends to vote no.
The clerk will now open the vote. Motion to favorably report H.R. 740 as amended. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the total.
Mr. Chairman, there are 12 ayes and 11 noes.
There are 12 ayes and 11 noes. H.R. 740 as amended is favorably reported to the House. Without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on the amendment to the amendment in the nature of the substitute offered by Representative Ramirez to H.R. 1663. The question is on agreeing to the amendment. Members will record their vote using electronic voting system. The chairman intends to vote no.
Ranking member intends to vote yes.
The clerk will now open the vote on Ramirez amendment to the amendment in the nature of a substitute to H.R. 1663. Have all members voted? Yeah. Does any member wish to change their vote? Hearing none, the clerk should close the vote and announce the total.
Mr. Chairman, there are 11 yeas and 12 noes.
There's 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The question now occurs on agreeing to the amendment in the nature of a substitute for H.R. 1663 as amended. All those in favor say aye. Aye.
Aye.
Those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of the substitute is agreed to. The question occurs on nope. Okay. All righty. We still have to make the motion to report. I've got to get to that. What page? I now recognize General Berkman for a motion. There we go.
Mr. Chairman, I move that the committee favorably report H.R. 1663 as amended to the full House.
All those in motion is on favorably report to the bill to the floor. All those in favor say aye.
Aye.
Aye. All those opposed, no. The motion is agreed to, and H.R. 1663, as amended, is reported favorably to the House floor. Okay, now we go to the next. Okay. Which one? 39. 3951, yeah. Okay. The committee postponed further proceedings on amendment number 1, offered by Representative Ramirez to H.R. 3951. The question occurs on agreeing to the amendment. Members will record their vote using electronic voting system. The chairman intends to vote no.
The ranking member intends to vote aye on this amendment, which restores collective bargaining agreements for VA employees.
The clerk will now open the vote on the Ramirez amendment number 1 to H.R. 3951. Have all members voted? Does anyone wish to change their vote? Hearing none.
Ms. Morrison, you're...
Hearing none, the clerk should close the roll and announce the total.
Mr. Chairman, there are 11 ayes and 12 noes.
There are 11 ayes and 12 noes. The amendment is not agreed to. Without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on amendment number 2 offered by Representative Ramirez to H.R. 3951. The question occurs on agreeing to the amendment. The member will record their vote using the electronic voting system. The chairman intends to vote no.
Ranking member intends to vote yes.
The clerk will now open the vote on the Ramirez amendment number 2, H.R. 3951. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 11 yeas and 12 noes.
There are 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. I now recognize Representative Berkman for a motion.
Mr. Chairman, I move that the committee favorably report H.R. 3951 to the full House.
The motion is to report favorably to the House H.R. 3951. All those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 3951 is reported to the full House. The committee postponed further proceedings on the amendment to the amendment in the nature of a substitute offered by Representative Takano to H.R. 3483. The question occurs on agreeing to the amendment. Members will record their vote using the electronic voting system. The chairman intends to vote no.
Ranking member intends to vote yes.
The clerk will now open the vote on the Takano amendment to the amendment in the nature of a substitute on H.R. 3483. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 11 yeas and 12 noes.
There's 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The question now occurs on agreeing to the amendment in the nature of a substitute to H.R. 3483 as amended. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. The amendment in the nature of a substitute is agreed to.
Mr. Chairman, I call for a roll call vote.
A recorded vote has been requested. The question occurs on the agreeing to the amendment in the nature of a substitute for H.R. 3483 as amended. Members will record their vote using the electronic system, voting system. The chairman intends to vote aye.
Ranking member intends to vote no.
The clerk will now open the vote on the amendment in the nature of a substitute to H.R. 3483 as amended. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the total.
Mr. Chairman, there are 12 yeas and 11 noes.
12 yeas and there are 12 yeas and 11 noes. The amendment in the nature of a substitute for H.R. 3483 as amended is agreed to. Without objection, the motion to reconsider is laid on the table. I now recognize General Berkman for a motion.
Mr. Chairman, I move that the committee favorably report H.R. 3483 as amended to the full House.
The motion is made to report H.R. 3483 as amended to the full House. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. The motion is agreed to.
Ask for a recorded vote.
A recorded vote having been requested, the question occurs on the motion to favorably report H.R. 3483 as amended to the full House. Members will record their vote using the electronic voting system. The chairman intends to vote aye.
Ranking member intends to vote no.
The clerk will now open the vote on the motion and to favorably report H.R. 3483 as amended. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 12 ayes and 11 noes.
There are 12 ayes and 11 noes. The H.R. 3483 as amended is favorably reported to the House, and without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on the amendment to the amendment in the nature of the substitute for the Representative Budzinski's to H.R. 3494. The question occurs on agreeing with the amendment. Members will record their vote using electronic voting system. The chairman intends to vote no.
Ranking member intends to vote yes.
The clerk will now open the vote on the Budzinski amendment to the amendment in the nature of the substitute for H.R. 3494. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 11 yeas and 12 noes.
There's 11 yeas and 12 noes. The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. The committee postponed further proceedings on the amendment to the amendment in the nature of a substitute offered by Representative Ramirez to H.R. 3494. The question occurs on agreeing to the amendment. Members will record their vote using an electronic system. The chairman intends to vote no.
Ranking member intends to vote yes.
The clerk will now open the vote on the Ramirez amendment to the amendment in the nature of a substitute on H.R. 3494. Have all members voted? Does any member wish to change their vote? Hearing none, the clerk will close the vote and announce the totals.
Mr. Chairman, there are 11 yeas and 12 noes.
There are 11 yeas and 12 noes. The amendment is not agreed to. Without objection, the motion to reconsider is laid on the table. The question now occurs on agreeing with the amendment in the nature of a substitute on H.R. 3494 as amended. All those in favor should say aye. Aye. Those opposed, no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. The amendment in the nature of a substitute to H.R. 3494 as amended is agreed to, and without objection, the motion to reconsider is laid on the table. I now recognize General Berkman for a motion. All those...
Mr. Chairman, I move that the committee favorably report H.R. 3494 as amended to the full House.
The motion is to report H.R. 3494 as amended to the full House. All those in favor say aye. Aye. All those opposed, no. In the opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 3494 as amended is reported favorably to the House. In the opinion of the... Nope. Oh, we're all done. Now, that concludes today's markup. The committee...
Mr. Chairman.
Oh, yes.
Pursuant to House Rule 11, Clause 2, I give notice of intent to file minority, supplemental, additional, or dissenting views of H.R. 3494 as amended.
Without objection.
And, Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority, supplemental, additional, or dissenting views on H.R. 740 as amended.
Without objection.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority, supplemental, additional, or dissenting views on H.R. 3483 as amended.
Without objection.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority, supplemental, additional, or dissenting views on H.R. 1663 as
Without
amended.
objection.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority, supplemental, additional, or dissenting views on H.R. 3951.
Without objection. That concludes today's markup. The committee has voted to report 25 bills and 2 leases resolutions back to the full House. I ask unanimous consent the committee has staff be authorized to make technical, clerical, and confirming changes to the bills favorably be reported today, and without objection, so ordered. I also ask unanimous consent that all members have 5 legislative days in which to revise and extend their remarks and insert extraneous material on any of the bills that were favorably reported. Without objection, so ordered. I thank the members for their attendance today. The Committee for Veterans Affairs is adjourned. We will see you after the recess.